Namaste. Talking light cannot listen. You're muted. Namaste, Puniti. You are muted.
Okay.
So, Ushaji, I have asked Miss Ordone to join us at 1:10 after
Okay.
our prayers. Does that sound like the right time?
Yes, because I think we'll start the prayer at 1:02, so even latecomers stragglers can get in.
Yeah, 1:02 or even 1:04, and then do our prayers and any announcement that Gauravji might have, and then I'll introduce Miss Ordone, and I'll ask her questions pertaining to child counseling and go from there.
Okay, so the format will be that you'll be asking the questions and she'll be kind of...
She'll respond. Yeah, I thought I'll change it up because it gets monotonous otherwise.
Yeah,
So keep it.
I'm quite excited. I think it'll be fun.
Keep it as a dialogue, and she's an expert in her field.
Wonderful. Yeah.
Namaskar.
Namaskar.
So the class
Namaskar, Gauraji. Sorry for the panic call.
No problem. I think we're good. I don't have any announcements, so you can please proceed at will.
In that case, Ushaji, let's start the prayer just a tad later because I've asked her to join at 1:10.
Okay. Let's see how many people are... Okay. Let's see, participants. Okay, people are still coming in.
Oh yeah,
so
we'll
wait a
it's still early. It's very early. Generally, till 1:05 they come in.
They come in. Okay. You won't believe it. Friday and Saturday, my internet was down.
Oh, thank God it's up today.
And they sent a technician yesterday at 5. And I don't know what he fiddled with. He said he changed some wires. I don't know what he did. She's a colleague of yours?
She's a colleague of mine, and she looks very young, but she's a very seasoned clinician. Yeah.
Somebody said something. So spring forward, it's not been too bad, huh?
Yeah, the spring forward is a little hard usually, right? Because
Yeah.
you lose an hour.
So I was thinking like, so next week's discussion, so if it's going to be 8:30, I guess we'll be in and okay by then, right?
Ushaji, much less work for you for this session. So I'm going to add to your responsibilities of giving me a wake-up call.
Okay, oh, gladly. How much time do you need? An hour?
Yeah, an hour is good. And I mean, I always wake up, but I always have that anxiety. What if I don't,
Yeah, no,
I'm an early riser. I'm usually up, by 6:30, 7 these days, 7, maybe because of the time change, 7:30. So I usually, I'm not too late, but I always have that anxiety. So when I assign that responsibility to someone else, I can sleep more.
Yeah. No, that's very true. And that's the reason I never set my alarm, because the moment I set my alarm, I'm up since like 2 or 3 hours prior at 3 a.m. in the morning, waiting for the alarm to ring. So it defeats the whole purpose.
Namaste Usha ji, namaste Puneet ji, namaste everyone.
Namaste. Yeah.
Manu ji or Niti ji?
Manu.
Manu, okay.
Okay, it's a one. So I think today will be pretty interesting, though, right? Hi, Sandhya ji. How are you? We miss you in our Thursday afternoons.
Yeah, things are not going well. That's why
I understand. Yeah, yeah.
So looks like we have to give them some more time. I think right now we only have 6 people, and we have a class of 19. So
Yeah. I'm impressed with all of us who got here at 1. It's always harder on the first day, especially. And then you just kind of sink into it. And
Namaste, Puneet ji.
Namaste, Sandhya ji. How are you?
Things were not good with me.
Oh, I'm sorry to hear that. I hope you're feeling better.
Yeah, my dad passed away.
Oh, that is hard. And in India?
Yeah, on February 27th. So,
Oh, gee, that is so hard.
yeah.
And you couldn't go to India?
No, I couldn't get the flight, and no point of making him wait, right?
No.
yeah.
That's why online I viewed the whole rituals.
Right. Oh, well,
Yeah.
it is a very difficult thing to go through.
Yes.
Yeah.
So how was the Thursday class?
We had a very lively discussion last Thursday.
Nice.
Yeah. whenever we talk about our own personal stuff, it feels more lively than when we talk about something remote or philosophical.
Right. There were no gents this time?
Satish ji, you know, he's
Okay.
yeah.
Hi Punitji, namaste.
Namaste, Anita ji.
I think this is my first session with this group as FA.
Ah,
Yeah. Yes.
did you not do one in the beginning with Mukunji?
No. Because I was anticipating other things, so I just volunteered once with you and once with Mukunji. That's it. And I took both of them in the later sessions. I think we can start with our prayer and wait for people to, right?
Oh, let's give them another.
Maybe we can do some deep breathing, you know, instead of just sitting on, we can at least do that, right? So namaste, everyone, right? And welcome, like today, when it's spring forward, it always seems a little harder, but I'm glad we all decided to come because today is going to be really, I'm excited. I'm really excited to be part of this. Today, both sessions are going to be very interactive. So we'll really enjoy it, I know that. So let's first begin today's session with a short universal prayer, creating a safe space for us. Okay, let me get the prayer screen on. Okay, let me start screen share. Sit comfortably, please. Back straight. Close your eyes. Relax your eyes, face, shoulders, your belly. Let's do some deep breathing. Okay. Inhale deeply. Watch your belly expand as you inhale. And just let go. Inhale. Watch your belly expand. Let go gently. Inhale deeply. Let go. Inhale deeply. Let go. Arms folded at your chest. Let's say Om 3 times. Sahana bhavatu, sahanau bhunaktu, sahaviryam karavavahai, tejasvinavaditamastu ma veshvedavahai. Om Shanti Shanti Shanti. Rub your palms together gently. Apply it to your eyes and your face. Let the warmth of the palms permeate your face. Relaxed. And we're ready. Stop sharing. Oh, Puniji, I was just thinking. Okay, so should I have your course up, or shall we just leave it open for everybody to?
Just let everyone see everyone, because there is a benefit in seeing all the faces and interacting. I would encourage all of you who are here and feel comfortable to keep your videos on. It's always good. That way it gives us a slightly more personal feeling. Of course, if you have to, in the course of time, put it off for a little while, that's fine. But to see you and hear you, it's always helpful. And my colleague, Miss Ordone, has already joined us. And she is right here, and we are not able to see her as yet.
I am working on that, Puneet. Let me get my camera working. 1 second here.
Okay, all right, no rush. We have some minutes. So today I've changed the format a little bit. This was a task for me, and I could certainly have looked up some old textbooks and come up with some tutorial on counseling, but I thought that why not hear from the expert who does this on a daily basis, every day, from morning to evening, for years and years and years, and is one of the best in the trade, so to speak. So I want to introduce you, and please give a really warm welcome to Miss Monique Ordone. And Miss Ordone is a licensed marriage and family therapist, and she's a very skilled and respected child and adolescent therapist in Bay Area. And currently, Ms. Ordone works at Kaiser Permanente Child Psychiatry Department in Fremont. And as I mentioned, she has extensive experience working with at-risk children and teenagers in different settings, acute settings, outpatient settings. And she is absolutely adored by her young clients and very well liked by their parents and loved by her colleagues. I'm absolutely delighted to be working with her at Kaiser Permanente. Monique runs the intensive outpatient program for teenagers at Kaiser. She supervises trainees who are on their way to become licensed therapists, and she's very involved in her church community. So at church, she does speak to a group of people about counseling children and issues that children and teenagers encounter for her church community, and she's invited by other churches around as well to talk on the subject. So she is absolutely the perfect person for us to dialogue with today. And if you are wondering how, whether I'm lying because she doesn't look so experienced, it's because she is an athlete, an avid runner, and she actually even teaches Zumba classes for many years at her church community. And when someone is, doing such enormous number of steps a day, sometimes I'm like startled. She's done in one day what I would do in a week. So that always pays off. So I want to extend a warm welcome to you, Monique, and let's give her a big hand. So
thank you.
Monique, as I mentioned to you, this is a community, we have here counselors of Hindu tradition, persons who are from different walks of life who are trying to give back to the community and learn some skills as before they start giving back. So it's kind of good that they have a little bit of know-how to work with different clients, including children, and also know when to refer out. So I, at this point, want to invite if anyone else has any burning starting question before we jump into our curriculum that I have in mind. Questions of me or of Ms. Ordone? Okay, then in that case, I'm going to start. So, and I'm just going to call her Monique because that's how I call her all day long. So, you know, Monique, what we have in this forum, which is different, is that we add the word J-I, next to everyone's name as a form of respect. But I think I'm just going to go ahead and call you Monique. Monique, some of the questions that we have here about children and counseling them, and let me pull them up. So just to let everyone know that we're just going to have this dialogue, and I'm just going to ask Monique questions, and you know, she will answer them, and in her answer lies the best way for you to learn about child counseling. I don't think you could get it better from a textbook. Also, you know, after, you know, she's answered, if you have some questions, go ahead. However, if I find that we are derailing or the answer is getting too long, I will, you know, kind of segue on to the next question. So Monique, let me start with the first question to you. When should parents reach out for counseling for their children?
All right, let's jump right into it. And thank you for that beautiful welcome, Puneet. I really appreciate it. It's been an honor to work with you. And I commend all of you that are here wanting to serve your community. I do believe that that's the best route, is we have to step out of our comfort zone and work to serve our community. So thank you for being here today. Thank you for that warm welcome, Puneet. All right, so when should a parent reach out for counseling for their children? When there is a noticeable shift in behavior or mood that's disturbing their functioning. And for children and teens, functioning, we're looking at how are they doing socially? How are they doing academically? How are they engaging with the family? Parents know their children better than anyone else. So when I often hear parents say, I felt it in my gut, something is not okay. There's a shift happening. And we as clinicians are looking at the functioning. If you have a kiddo that's outgoing, was getting straight A's, and all of a sudden they're bringing home failing grades, they're isolating in their room, it's important to check in. Now, I always encourage families, ask your child, communicate, point out what you notice, point out like, hey, you know, you don't seem to be functioning as yourself. It might be something that could be managed within the home, right? Maybe, of course, a common one right now is with COVID. They're feeling isolated and they need the family support to pull them out more. So first and foremost is communicating in the home, seeing if there's some shifts that can be made. And I also tell families, you know what, try some shifts, try some changes for a set amount of time. And if the functioning does not improve or it gets worse, please reach out to a clinician or for counseling support.
I have a question here, Monique. Thanks so much. I mean, I'm just trying to understand the behavior that I've seen with my kids is if you try to ask too many questions from teenagers, they get irritated. I mean, it's just the only answer you will get is, it's okay, you are like, fine. I think each one of us is like, for each one of us, I mean, getting something out of your kid, especially when they're in teenage, it's very hard. So as you said, right, we should communicate with them, try to get things out of them. Is there a skill? I mean, is there some way which you can talk to them so that they are like more open to you? I mean, I've seen that this is like just asking them straight does not work for me. So just a question here, if you can just help me with that. I mean,
yes,
yeah.
Of course. That is a beautiful question. Such a beautiful question and a common question because they're not the most forthcoming, right? I'm fine. I don't know. You might get the irritability or the agitation that goes with it too. So I have had parents do very creative ways, such as writing down. I spoke with the parent on Friday, actually, where her and her child were journaling and writing letters back and forth. Or I always tell parents, you can use a fictitious teen or someone, oh, Mary's son is really stressed out with this. Is that a concern you have? Right? So you're kind of introducing something that might be hard to talk about by using a fictitious person. Writing is really powerful too. And being transparent with your own distress. I know as parents, sometimes it's hard to want to acknowledge that, hey, it's hard for me too. But I find with children and teens, when they know it's okay to not be okay, then they're more inclined to open up. If you try all of those things, Pooja, and it's still a struggle, you can call and get some more help. A clinician could help navigate. And we're pretty good at pulling things out of kids. So you can try those things there.
Thank you.
Monique, the other thing was sometimes it's helpful to notice some developmental concerns early on, because that can sort of dictate how the progress and functioning is going to be in the following years. So what are the main developmental concerns in children? And then what are the main social stressors? I guess it's a two-part question.
Yeah, so developmentally, being a child therapist, adolescent therapist, I believe in early intervention. The earlier you get them in, the prognosis is better, right? I rather talk about behavioral concerns or social concerns, learning concerns when they're 6 versus when they're 16. It's a lot easier when they're 6 and they're more receptive and they're still trying to figure things out than when they're 16 and they already think they know everything. So developmental concerns to be on the lookout for. We always ask about milestones. Did they walk on time? Did they talk on time? Did they engage in imaginative play? Communication skills. We're looking at that to rule out any neurodevelopmental concerns. So it's important to inquire about those developments. Engaging with friends. How do they do socially? That's important to pay attention to that. I also run a social skills group at Kaiser for ages 9 to 12. So knowing how to engage, how to not be rigid, how to communicate your needs, express your feelings. You want to pay attention to that at the younger age. If we think about development as you go forward, those teen years, you want to pay attention to that. How are they navigating the teen years? And there's a process called individuation. Individuation is when you're pulling away from your origin, your family unit, and you're trying to figure out who you are as an individual. And that can be a tricky time for teens and for parents, because you're figuring out, do I believe this? Do I believe that? Do I follow these practices? I don't want to shame my family. So it's individuation is another developmental stage that requires some support and some help at times. Social stressors. I'm sure you guys are all aware of the stress that our youth are under right now, with the demands of academics, with the demands of social media, with the demands of their peers. So just knowing that there's so many stressors out there, and you can never really pinpoint one cause of distress, right? Is there developmental concerns? Is there peer concerns, family concerns? You can never really pinpoint one thing. So keep all of that in mind as you go through the developmental stages. And also know that every child is unique. So if my older child walked at 11 months, but my other child didn't walk till 15, don't let the alarm go off right away. Just know that every child is different, and have a medical professional, a clinician step in and help you figure things out. Okay? So every child's unique and develops differently. Okay, there are stages we're looking for and averages, but we can figure out together if there's any reason for concern.
Monique, autism spectrum disorders are coming in, becoming diagnosed more often. Are there any early signs that the children and that the parents can hone into? Or if they complain about, our counselors can sort of ask about, just to make sure that, because, with them, with ABA and all that, it's good to have early intervention. Maybe you can even mention what ABA services are. Thank you.
Yes, autism, very, very common, often, sometimes undiagnosed. autism is a spectrum. So you have individuals that are higher functioning, formerly known as Asperger's, where there's some rigidity, some social concerns, to your lower functioning individuals that may not be verbal and require more care. So it's a spectrum. Some things to look out for your younger individuals. You typically see signs right before about age 2 or a little bit before, delayed in verbal skills, so not speaking within a reasonable amount of time, rigidity, so having a hard time, emotional distress or very big tantrums, very rigid in how things are done, lack of imaginative play, so having a hard time pretending, eye contact, a lack of eye contact. Perspective taking is another one. So perspective taking, having a hard time seeing the perspective of another person, right? So trying to understand how another person may feel might be very difficult concept for a child on the spectrum. Let's see. Sometimes we have kiddos that are flight risk, so they may run away when they're in distress. Sensory concerns, so textures, certain taste, food, clothing. I have some kiddos that the clothing is really disturbing to them, or they prefer pressure, a lot of weighted blankets. They need that pressure, that containment. These are some things, and some kids might present with all of these kind of features or just a few, and but I think it's really good to try to inquire and rule out and ask these questions regarding functioning when it comes to the spectrum. Early intervention's key with autism, because you do have ABA, like Dr. Mahendru mentioned, applied behavioral analysis, and that's where people come into the home and they support with behavioral interventions. With autism, it's a neurodevelopmental disorder, so it's very important to have kind of consistency and consistent behavioral intervention. So give me the spoon, okay, give me the spoon, then you celebrate them giving you the spoon. So it's way more complex than that, but it's very concrete and it's very consistent, and people come in the home. Some kids have ABA services in their home 2, 3, 4, 5 times a week, depending on the need.
So, Monique, essentially what I'm hearing you say is that if a child is, extremely upset with the smallest change in their routine, and that's happening consistently, then it's something to just watch and observe if other things are present as well. Mm-hmm. And if they are extremely sensitive to textures or fabrics or certain kind of things, way too particular, yes, then that's another sign. And sometimes they just want to play with one toy, and now all kids go through that phase, but some of them, they might just want to play with one toy all the time and be like very obsessed with it, and then ignore everything else. That's something to watch out for?
Of course, yeah, hyper focus. So I have like one little boy who is trains, like very obsessed with trains. Everything's trains, lining up trains, everything, books, trains. And then Puneet mentioned a good thing to consider, the change in routine. It's very hard. We can have one slight change. We always have pizza on Friday. Oh, this Friday we're gonna have Chinese food, and it's a meltdown, it's a tantrum for something that neurotypical people would say, oh, it's not a big deal, but for this child, it is a big deal. So we go over, when I do social skills group, I'm thinking of being a flexible thinker versus being what we call a rock brain thinker, helping kids understand that concept of being more flexible. Puneet also mentioned sensory sensitivity. I have an individual kiddo who brushing the teeth is really hard because of the sensory, and even the taste of the toothpaste is too much. Textures of food, right? The texture, different textures they just do not like. So keeping all of this in mind is important.
I think Kishorji has a question. You want to unmute yourself?
Yes. Yeah, Monique, I have a question that you said that a certain type of clothing is supposed to be disturbing to a child. Then is it a disorder or a sign of autism? or how do we treat it?
A change of routine, you said?
No change in the disturbing of clothing disturbance. Or preference, certain preference for certain type of clothes.
Yeah, that's not the only, for autism, you have to have a lot of different symptoms and traits. That can just be a preference. So I don't want that one thing to that it's autism. But with the clothing, it's really important to find alternatives. So I have a little boy who only wants to wear shorts, even when it's cold, right? So we've had to work with parents and get creative with what we can do, different textures of sweats he can do. And just, it's sensory sensitivities. There's not really much you can do but figure out alternatives and try to get creative with it. And just, yeah, with time, more exposure to different kind of textures. So let's try this kind of pants. Let's try this kind of pants. Trying different pajamas at night have helped too. So then during the day, then he's more willing, but it is a real sensitivity, right? It's hard for us to wrap our heads around it, but imagine like feeling like little needles are prickling on you, right? It's a real sensitivity. So it's just exposure and trying different things. With food sensitivities too, occupational therapy sometimes steps in and they do practice with different types of food. So trying just with time to get used to it.
Any other questions?
Thank you.
You're welcome.
I'll ask a question, Puneetji. So I think, Dr. Ordane, you touched upon being in COVID times, children are really going through anxiety and it's hard to differentiate, is it just like temporary or is it extended? The schoolwork is online, the friendship and socializing is online, the games and plays are online. So how do you balance it with children where you kind of have to give them off screen time as well. So it's kind of developing some anxiety. Do you have any tips or could you talk to that point a bit?
Yeah, in my work, of course, the past year, but even more recently over the last few months, my keyword in session has been intentional. We have to now be intentional with our day and what we're doing to occupy our time. So I've been working with parents to create, even for parents to get away from the screen, going outside, going for a walk. But I'm not just saying that, we have to be intentional with it. Monday, Wednesday, Friday, we go walk around this lake. Tuesday, Thursday, we're biking, right? Thursday, game night. We have to be so intentional now because it's so easy to get sucked into this world or sucked into this isolation. I've been creating so many schedules with families. This is what we're doing on this day, that day. And right now, a common thing coming through triage or coming through my office is school stress. The kids and the teens are over it. They are done. They don't want to log on. They're not completing the work. And parents are at a loss of what to do. What I want to normalize is if this were a typical school year, right around the end of April, it's spring fever. They're over it then. We're just seeing it a bit earlier this year because of the conditions. So what I've been talking to my teens about, it's mostly them, you have completed this much of the school year. You have this much to go. We are at the last leg of this run, of this marathon. So can you hang in there? Because if you don't, you're going to spend a summer in summer school, right? You're going to miss out on the free time when COVID's kind of clearing up and getting better. So it's really about encouraging. I'm helping parents by reaching out to teachers, saying, can they just show understanding of a concept versus completing the whole assignment? So we would be experiencing this now if we were in non-COVID times. It's just hitting a bit earlier and a bit stronger. So the key word to give to families is be intentional with your day. Be intentional.
Thank you.
I think Narayanji has a question.
Welcome.
Narayanji, you want to unmute yourself? You have a raised hand.
Can you hear me now?
Yeah.
Okay, sorry about that.
No worries.
I have a question. I mean, you talked about, kids creating tantrum if Friday pizzas are not available. And then you're also saying that we need to have a routine with respect to Monday, Wednesday, Thursday, Friday, I will do this. So isn't it better to have a little bit of randomization of activities so that you don't get fixated with a particular programmed life?
Yeah, if when I was mentioning the pizza and the rigidity, that was more related to the autism, right? The struggles with routine. But yeah, it's family. For instance, I'll be transparent with my own family. I might not say it's a walk every Tuesday, Friday, but we know we're going outside and we're doing some activity, right? We're just being intentional with stepping outside of the house. We're being intentional with our physical activity. We're being intentional with our diet. You know, it's something we actually have to put a lot of thought in now because of COVID times. Yeah.
No, because I knew parents who used to take the child for a car ride after dinner every day so that the child will fall asleep.
Oh yeah. Yes. Yeah. Just know if you do that, you're gonna be doing that for a long time. I like variety. I like, yeah, possible. Yeah.
Thank you.
Just like if you rock a baby, right? If you rock a baby, they're gonna expect you to rock them all the time. So if you can change it up, that's good.
Thank you.
You're welcome.
Monique, now, you know, when adults are anxious, they sort of express the anxiety in certain ways, and they might have different symptoms. And when they're depressed, they often do recognize that they're feeling sad or they're not, and you know, they become very quiet and they retreat many a times. Sometimes, or in fact, often with children, the manifestation of anxiety and depression can be quite different. In fact, many parents don't recognize that their child might be depressed because they don't see the same kind of retreat. They might see tantrums instead. So would you speak to that a little?
Yes, yes, yes. I let parents know that anxiety, depression for children, teens can look more agitated, more irritable, more moody. And so parents have a hard time. Is this just normal teenage moodiness and grumpiness? Or is this anxiety and this is depression? Just know that you want to look at their presentation. It could be agitated, irritable, isolating, but also that functioning, withdrawal, pulling away. Anxiety, a lot of the teens I've worked with over the years, they tend to internalize how they feel. So they're holding it in. Right. So therefore, you might see a little irritability sneak out, or more restlessness as well, more slamming of doors. Right. So that can be an indicator. Unlike adult depression, anxiety, that tends to be more, to me, more common textbook-like, more kind of isolated, low energy, sleep disruption. Kids could have that too. I just know that for teens and youth, or children and teens, look for the agitation. The irritability can be a huge indicator, and the pulling away and isolating, less interest in engaging with others.
Monique, but it's hard to tell, right? We like teenagers, they're at a stage where they know everything. Parents know nothing. So naturally, anytime you open your mouth, they're going to be irritated. They're going to say, gosh, I know what I'm doing. And will you please leave me alone and give me my space? And, you know,
Yes.
But how do you distinguish that from a child who's genuinely going through an anxiety, a depression, a withdrawal? Because the symptoms pretty much for a parent are the same. So you could just, you know, let it pass and say, oh, well, he'll outgrow that, she'll outgrow that, you know, might not catch it in time. What are additional symptoms, or what else? Like, are they?
Yeah, let me go over some additional symptoms too, but I also want you to keep in mind the baseline of the child too. So if you had a child that's always been a little snarky, snappy, even when they were little, then you're like, okay, that's just my kid that's like that. That's my older one, by the way. Just a little bit more, you know, so keep that in mind, the baseline of the child, but also paying attention to sleep habits, sleep disturbances, not being able to sleep or sleeping too much. Pay attention to hygiene. I've had kids that just all of a sudden, they're just not into their hygiene, right? They're just not really caring, paying attention to that schoolwork, that's a functioning. If you've had a kiddo that tends to do well, passing grades, and all of a sudden they're like, I don't really care anymore. That's a very good indicator as well. Appetite, eating more, eating less. I've had people gain way more than the COVID-15 because they're trying to medicate their distress with food. So paying attention to that as well. Loss of pleasure in things they used to enjoy, right? So they used to love coding and now they just like, I don't want to do it. Low energy. Okay. So all of these are kind of symptoms, depression, anxiety, but you just moving way away from the baseline, and there's a change in functioning. And again, remind parents when you guys are speaking with them, you know your child, you know if there's probably more to it. Trust your gut, trust your gut.
So how do we deal with it? Like, so these are all symptoms, right? We can find out the symptoms, but how do we work with them? Do we need to necessarily take them to a psychologist or like a therapist, or can we do something at home that can help them?
Yeah, so I am always asking parents about the basics. So before we're determining if they need therapy, intervention, mental health intervention, the basics are, let me ask you about their sleeping habits. Let me ask you about their eating habits. Are they getting physical activity? Or are you encouraging engagement with the family? These are the basics. So if I did a triangle here, a hierarchy, we got to make sure you're meeting those basics, because that poor food intake can alter your mood. Isolating can alter your mood. Lack of physical activity can alter your mood. A lot of families are coming into our department. Kids are struggling depression, anxiety, and as clinicians are finding out, they're getting 3 hours of sleep at night. Parents didn't know. They're on the phone or they're gaming. Okay, well, that's the first step, because you and I know that with 3 hours of sleep, you're not going to be in the best of mood. I talked to a young lady yesterday who her food intake, she's really nervous about weight gain. So we found out she's not been eating enough food. So her mood has been altered. So the first step is always the basics. Once you start meeting the basics, then we get into a more in-depth treatment of therapy, challenging your thinking, teaching you skills to cope with distress. I think, Puneet, we're going to talk about that, but so skill training, challenging your negative thinking, learning distress tolerance, how you cope and sit with the distress. So then we go to that level. But the most important thing I have to highlight is making sure those basics are being met.
Thank you.
You're welcome.
I think a lot of people have asked this already, and I think this is what they're dying to ask, because they've experienced challenges, and I've told them I missed the boat because my kids are adults now. So I wish I knew all this earlier. But so how to talk to children about feelings?
Oh, yes. Oh, man. I love this question, because even when we get the calls of the 2 and the 3-year-olds at Kaiser, you know, Puneet, we've been getting a lot of those. I'm asking parents, do you have a little feeling book? You guys know the little board books of feelings for the little ones, right? And they're like, no, we don't have that, because I think it's never, ever too early to start talking and communicating about feelings. And one thing when I'm doing classes or trainings or groups or parenting groups, I always want parents and kids to know there's no such thing as a bad feeling, a bad feeling. It's bad to feel angry. It's bad to feel sad. It's bad to feel anxious. No, 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 no. All feelings are normal, human. You will experience them. It's about how you cope and manage them. That's what we want to work on. So if every time you feel angry, you're punching a wall, then we need to work on that. But the fact that you feel angry, that's okay. We're going to figure that out and know how to work with it. So helping your child identify their feelings when they're very young, even by communicating directly when they're young. Mommy is sad. Mommy's angry. Mommy's, confused. Mommy, just using feeling words in the home and knowing, so they know it's okay to feel these things. Mommy feels a little tired. Mom, that's actually a state, not a feeling, but mommy feels a little sad. She's going to take a minute. She's going to take some space. Using the words early. In my own home, my oldest child, she was saying, I feel anxious in first grade. That's because we would talk about it. And now she's in fourth, but she knows her warning signs. She's like, oh, Mom, my stomach. I was feeling anxious before my test. Okay, what did you do? Oh, I did my breathing you taught me. She's been doing the breathing since first grade. So opening up that dialogue very early. And then I've also done with kids, even in COVID times, I've been doing share screen with them. And I'm showing them random pictures of kiddos or people. Say, how do you think they feel in this picture? Just so they understand noticing the feelings of others, and that others have feelings and emotions too. So they like, and then we could create a whole social story about one picture. No words on the picture. It's just a person. Say, oh, how do you think they're feeling? And then we talk about it. So it's all about dialogue and exposure.
So that's easy, a little easy when they are small kids, right? They like to express themselves. How do we do the same with the teenagers?
Yeah, with the teenagers, I have found a lot of success when teens come in, often agitated or irritable. I say, what's underneath that? I think that's the emotion you're showing, because it's this is a hard conversation for parents to have, but as a clinician, what's underneath that anger? And if we'll talk about, I think, rapport building and trust, but they often will tell me it's sadness or it's fear. I use the example of a parent. When a child runs in the street, your little child runs in the street, and you grab them and you yell at them, you say, don't run in the street, you don't do that. You look angry, but underneath it, it's really fear. And I tell a teen, you might look angry, but are you really scared or anxious about something? Anger, you have to know, is a defense mechanism to keep people back, right? So if I throw a chair and lash out and yell and scream, you will likely stay back and leave me alone, right? But if someone's brave enough to say, hey, what's underneath that anger? I'm not scared of the chair. What's really going on underneath that anger? I'm curious if you're really truly feeling sad or worried about something. That's how I've gotten my teens to trust me, and we go get past that anger.
So important that we're having this conversation. I feel more than children, I find adults who are totally clueless in their ability to express the feelings and to be open about, who they are. And so the conversation we're having, I think it's so essential to kind of have and give yourself the space. And like you said, feel okay by being angry or sad. It's like, differentiating for most of the growing up, it was always like, these are bad feelings and these are good feelings. But they're just feelings, and to be able to embrace them and be able to talk about them, I think is just a completely different conversation that I feel adults of our generation need to learn as well.
Yes. I had a very powerful family session not too long ago, because the kid was acting very aggressive and very defiant and yelling and screaming. And then when we sat down as a family, and this family, I've worked with them for such a long time, they know there's zero judgment there. Then Dad said, well, she does what I do. I get agitated and angry and yell and scream. And Mom said, yeah, I do that too. Okay, all right. So let's all work on changing how we express our anger. It was so powerful. And the teen did not feel singled out. Felt like, oh, thank you, Mom and Dad, for admitting that this is kind of learned behavior. I kind of learned this. So powerful. So yes, I think we all should have this dialogue.
Monique, I think Gigi has a question. Can you unmute yourself, please?
Yeah. Hi there. Yeah, can you hear me? Yeah, so Monique G, I'm going to call you Monique G because Miss Monique G, it's same to me. So
of course.
Out of respect to you. So I'm a clinician myself, but in a completely different setting. So I deal with adolescent, pregnancy, and sexually transmitted disease, and so on and so forth. So some background in counseling, won't call the expert myself. So I'm asking a question from the community point of view. So like, for typically Indian families and big friend circles. So if you notice that your one of good friends or your cousin, if you will, have a child who you have seen from growing up, and you seem to think that the child is acting very strange and not the way you see it, how to basically nudge the parents, if you will, to ask that, hey, can you do anything? And this is, I understand, this is not a clinical question because you're not a provider, but as a concerned acquaintance, if you will, how would you approach that? Otherwise, you will be called a nosy uncle, basically. You know. So.
Yes, yes, that's such a good question. I'm familiar with the communities and the involvement. One of my passions is trying to eliminate the stigma of mental health. So for years, I've been working and going around, and I think it starts within our communities. So coming with a non-judgmental approach, say, you know, how's Johnny been doing? Like just coming very gentle, don't go right for the jugular, like, hey, Johnny is strange and bizarre and over there with my daughter and just looking very strange. So just how is Johnny doing? You know, I've noticed this and that. Has a teacher mentioned this to you? Kind of very gently and asking for other, has anyone else weighed in? You likely will not be the first uncle or only person to notice this. I'm sure a teacher or another parent has probably brought it to their attention, and you can be reiterating that. So I noticed Johnny's playing with himself and all the other kids are over here. Is that common? Oh yeah. He just wants to play with his trains. Okay. I also noticed this and that. Any teacher ever mentioned that? And then they'll say, what are you getting at? Then you say, you know, as a loving uncle, this is my thoughts. And we have to work on eliminating the stigma in our community. And some parents might find some appreciation in you doing that. Yeah. So I've had to do it within my own community and family too.
No, thank you so much. I appreciate that.
You're welcome.
Monique, going on to a question which sort of segues naturally, how to gain the confidence and connect with the children? As counselors go out and they suddenly find that they have to interact with the child, you know, as our CHT counselors, if a parent asks them, gee, can you talk to my kid? He's going through some stuff here. How to win the confidence?
One of my quotes that I've worked by in these years I've been doing this work is, kids don't care what you know until they know that you care. I can spill out everything about mental health and coping skills and da. They don't care about that until they know I genuinely care. And how do you show a child that you care? It's inquiring, not telling. It's asking. It's non-judgmental. It's creating that space. Creating that space is so important, and it's containing that. So they first need to know that you're non-judgmental, that you're coming from a place of care and concern, inquiring just about them in general, or just about an interest they have, or, hey, I know you draw. Let me see some of your art recently, right? So we don't just jump in as clinicians. I can be trying to build rapport for a while, but I think I've gotten better at gaining rapport quicker over the years. So asking about, now that we're doing telehealth, asking about a picture in the background, or like, oh, I like that shirt, just so they know it's okay, you're in a safe place. So kids do not know they don't care what you know until they know that you care. So you have to convey that. However, we're all different in how we convey it. Is it your body language? Is it your demeanor? Leaning forward, appropriate amount of eye contact, because too much can be intimidating. Your tone of voice, right? Because are you here to support me? Or are you here to run back and just tell my parents everything and side with them? Right. And I always start with, just because of what I've been exposed to in my work, that there's nothing you're going to tell me that's going to make me fall out this chair. I always tell them that. And then they laugh a little, but I go ahead, try me. Come on. There's nothing you're going to tell me that's going to make me think of you as a bad person. There's nothing that's going to make me judge you negatively. My job is to contain the space and support you and meet you where you're at. So you have to hold me to that. Hold me to that. So far, it's worked.
So Monique, and before I ask the next question, just sort of a prelim to that, is that sometimes we as parents ask them about the things that we value in our children. So if we value their academic performance, we ask them about that. Or if we value certain skills, we ask them about that. These might not be the things that the child has upmost in his mind. And then the communication just doesn't click.
Right.
Because we are, in fact, they get irritated. All you care about is grades, and this is all you can think about. And I have to say, I have made this mistake with my kids. So, as I said, it's so late for me now. But but you know, how can we kind of align with them in order to gain confidence and talk about their own activity? Or maybe it's just a statement, not a question, but any comment?
Yeah, you come with nothing. Come with nothing. So another thing when I've done classes, parents will say, they don't talk to me, they don't open up, they don't, and I say, okay, are you being silent? If you take the letters of silent and rearrange them, it's listen. Same letters, right? So in order to truly listen, you have to be silent. So come more with how's it going versus tell me how is school? Tell me how is this friend? Tell me how is this friend? Just simply, how's it going? And teens aren't sometimes the most expressive, right? So you kind of might have to pull a little bit more, but just open up the conversation with more of a open-ended kind of question, because they might be worried about a friendship dynamic, but you ask about school. So it doesn't give the opportunity to talk about that friendship dynamic. I'm always asking about my own children, and in my practice, I'm asking about your social, your school, and you. What are your thoughts? What are you feeling? Right? So school, family, social, but you, what have you been thinking about, worrying about, reflecting about? That's what I care about the most.
So Monique, in Fremont, Kaiser, we are I think we've got such a wonderful vantage point because we see so many Asian Indian children and their parents.
Yes.
So what have you noticed about the concerns that they bring in? Anything that stands out to you amongst Asian Indian children and their parents?
Yes, it's been such an honor to work with the South Asian community. And I've learned so much over the years, and I'm so thankful that they've let me into their experience. So some of the common things that come up is with my teens, they come with this shame of feeling distressed. They also have communicated feeling like their feelings have been minimized or ignored. They'll say, Monique, I told my parents 3 years ago, and it's not till I mentioned some serious concerns about self-harm or suicide that they called you guys, but I told them this a long time ago. Family dynamics with communication, academic pressures. My older teens right now, especially as college, which college they're going to, parents aren't pleased with the college or the majors that they're choosing. So we've been working through that. An individuation process. So this is common across cultures, but pulling away from the parents and trying to individuate and figure out who they are. Perfectionism, that's a very common one. Colorism. I've worked with a lot of Indian families with, I'm big on self-esteem. So I've done a lot of workshops and trainings on self-esteem. And so I've had a lot of young ladies actually with colorism concerns and the pigment of their skin. So therefore not feeling confident in themselves. That's been a frequent one. that I've had. So a variety of different things have come. Do a lot of family work as well. Do a lot of family work. And because I believe as a parent, you are the agent of change. Yes, I'm the therapist. Yes, I'm the clinician, but you are the agent of change. This child goes home with you. They live with you. You have to, if I say I want you guys to try X, Y, and Z at home, I really need you to try it and implement it. I've had a lot of parents call me because their child is having a tantrum and a fit. Talk to my kid, talk to my kid. And I say, okay, what did I want to empower you. You're the parent. You're the parent. I'm not always going to be accessible or around. Let me empower you, because you're the agent of change, not the clinician. You as the parent are the agent of change.
So you mentioned something that I want to sort of focus on further, is that when we work with children, especially young children, not teens, the work is more with the parents, and very often Monique's been kind, but I think very often with Indian parents, their approach is, here, do something to my kid, fix him, right? And they're throwing a tantrum, you take care of him. So instead of thinking that they have to somehow manage it and feel empowered to do that, there is this approach of fixing the person or the child into conforming, into good behavior, into better grades. Sort of like going to a physician and getting a course of antibiotic, and after 10 days, the infection is gone. So that approach obviously doesn't work. So knowing that parents have to do it, and the therapist can be a guide, a support person, but the parents have to change their behaviors. The parents have to deal with the tantrums, whether they are teen tantrums or autism tantrums. So the parents are the people who have to manage. Just wanted to focus on that some more. The other thing I wanted to also focus on is that the pressure, the academic pressure, the parents and therefore their children get so hyper focused on choosing the school. They might have like 2 best schools or colleges, and they think that there is a right and a wrong choice between those 2 schools. That if they were to err on the side of choosing school B instead of school A, that the entire destiny of the child would change. And usually that hyper focus on something so small, important but narrow, just sort of completely eclipses all the other emotional stuff and anxiety that may be going on around academics, around social interactions. Would you say so, Monique?
Yes, definitely. When you were mentioning the parent part, Puneet, I'm going to go back and just reiterate one thing real quick. Please know that parents can reinforce behaviors. So I've had kiddos that will tantrum and teenagers that will tantrum or get really aggressive. So then therefore the parent will give in. And when you give in, you just taught the child, this is how you get that need met. So I've had teenagers that are assaultive to their parents, destroying things at home, running away, and then the parent will give them what they want. And then the teen and I've had teens tell me, well, it works. When I get in my mom's face and I yell and scream, Monique, she gives me what I want. They told me that out of their mouth. So please know, as a parent, you are the agent of change. So that's one thing I wanted to mention. In regards to the academics, being here in Fremont, and then we have very high performing schools here in Fremont. And what happens is I've had a lot of parents say, oh, they didn't get that pressure from me. I'm not like those other parents that do that. I don't do that, Monique. I don't do that. And then you talk to the child and they're like, yeah, they don't do it now. But when I was in 2nd grade, 3rd grade, 4th grade, they talked to me a lot. And I internalized that pressure. I now bully myself in my brain And when I get an A-, it's the end of the world, or I got a B, so now I'm cutting myself or harming myself. So it's really important to recognize how you are directly or indirectly. You can talk about their cousin who is getting straight A's and going to this school. And are you indirectly insinuating that they're not as good as that cousin, right? So it's just very important to be mindful of that. And now my teens, it's college acceptance time right now. So man, my schedule got packed real quick. Kids I haven't seen in a while are now back in my schedule because they didn't get into this school or they got into this school, but parents aren't pleased with this school, that school, and majors. I have kiddos that want to do creative arts and their parents are like, no, you have to do science or medicine. And I don't want to make light of this. I worked prior to coming to Kaiser, I worked 10 years in a psychiatric hospital, an inpatient hospital. And I've had the honor, and I say that very intentionally, to work with children and teens that should not have survived their suicide attempts. And they did. And it was over a variety of buildup of things, but it was not feeling they could reach the standards of their parents' desires. And I've had very hard conversation with parents. Are you going to put their report card on their grave? And that is so blunt and direct, but I had to really put it in perspective for some families, because the reality is, I don't know how your child survived this. The things that I've seen in my 10 years at the hospital has blown my mind with these kids. They clearly have a purpose because they survived. So it's really important to put things in perspective and know that the career they choose, they're going to be working 8 to 10 hours a day. And we want them to be happy with that. And know that if you're happy with the career you choose, you will do well and you will excel. So keeping all that in mind.
I have a question here.
Yeah.
I have a question also.
Monique, yeah, can I ask it? Yeah, okay. I think we are kind of, converging towards a question I had about 15 minutes ago. So the question is, did the anxiety or expectations of the parents in itself lead to misplaced interpretation of the kid?
Mm-hmm.
Right?
Yes.
And so which means we have to figure out whether the kid needs counseling or the parents need counseling.
Most of the time, it's the parents who need counseling in these instances.
Yes, right.
I think the parents.
That was exactly my point as well. For example, before going to middle school, I feel maybe parents need a good education, what they are dealing with, because as a parent myself, I had no idea what kind of peer pressure they go through, the friendship, fitting in and ridiculed by other kids and favoritism, colorism, so many things are out there. But growing up in India, I am not aware of all these things. So it was very new. We came to know very late in the stage. As Punitji said, I wish I have known these things. Same thing, it goes for all the parents. Maybe they need to be educated. Beginning of the school, they used to have an open house. Maybe they should have something for parents explaining what these kids goes through and what kind of support parents can offer when they come back home. So that way parents are know what is happening. We had no clue being in that state. Yeah.
I appreciate those comments too. And I think when you work with a child, so I'm a child adolescent therapist, but they're my patient, my client, but the parents are too. So you come as a unit. And oftentimes I'll do just parent only sessions because I want to make sure the parents, they move, because a lot of parents feel really guilty, right? They feel really bad. I work with amazing people that are just, they care, they love their children, they want the best for them. So I help them move past that guilt and say that this wasn't intentional. So how do we make the shifts and the changes now? And how do we work on your own anxiety, right? Because you are displacing your anxiety onto your child. So we work on that. But yes, I agree. Parents open house. I like that idea to have the conversation.
Parents need to educate it because they had no clue just to fit into, because kids can be brutal in middle school and high school.
Yes.
They are very mean.
Yes.
And what kind of damage they can do to our kids, we had no clue.
Yep.
So it's very important. Parents are very supportive when they come back home.
Yes. And it's the physical appearance, right? How you look, but also there's a school here in Fremont. My patients were telling me there's a class where the teacher makes them race to the board. So they're racing and they were tripping each other to get to the board. They're asking, what did you get? And if you got a lower than an A, you're ridiculed. There's pressures everywhere just to be this ideal, perfect being. So my heart hurts for all of our youth right now.
Basically,
okay. You had a question?
Okay.
I think Poojaji, you too. So
yeah, I have a question.
One of you go first and the other can go second. We are running out of time also. So.
Okay, let me ask quickly. So as everybody is saying that it's a parent who needs a counseling, in the same lines, I want to get counseling on this thing. I fully accept that, yes, I really want my kids to get some direction in life, and we look for the best school so that they get good social, they mingle amongst the people who are like them. So what I see is like this is what my opinion is. Like, I have seen my older one and younger one. My older one is very hardworking, and if you put him in a school like Challenger, he will actually enjoy, because I think he has the potential. He can learn more and those things. And this is my observation. My younger one is like, on the other hand, enjoy playing more, so he likes public school. So basically, on that analysis, I put him in a public school or private school, or like the school, and I'm fully okay if my younger one is he goes into arts and all those things. But he should have I don't see any inclination from him in any direction. So sometimes I feel that he needs direction, in the sense that, okay, we need to really push him for something so that he gets into something. He cannot decide. He has taken all kinds of sports in the world, and like he just took 4 or 5 classes and then he gives up. So am I doing bad? It's like, am I being pushy? Is it not something like, are we not supposed to shape their career so that they actually remain happy in long term? Or is it we should just let them do whatever they want to do and then just get onto the other side? So that's my first question. Like, how should I deal with my younger one who doesn't have any direction in any field? It's like, that's what I don't see it for now.
Poojaji, may I interject just a tad? So, you have some valid concerns, and they are good questions that everyone can benefit from. And our follow-up session on Saturday morning will address some personal concerns like that. Okay. So, but just because I'm aware that we have 20 minutes and we've only covered half the material, so I would at this time like to apologize that we are leaving some questions unanswered. But we will have a Saturday morning follow-up, and please be there. I'll make sure that I address that for you. But let me just go on just a little bit further. So I apologize, Poojaji, and I know
no worries, I can understand.
I know you had question too, and I will address that in just a bit. Let me get on. So Monique, I wanted to ask you, what are some of the strategies that you use in counseling children, which might be different from maybe the adults? What are some of the ways in you counsel children?
Yeah, I used evidence-based treatments. So you guys, I'm sure some of you have heard of cognitive behavioral therapy. So I'm helping them recognize their thinking errors or how their thinking is making them feel bad. I also do a lot of ACT therapy, so acceptance commitment therapy, so accepting the reality, accepting how you feel, not fighting up against it. So I do all of those evidence-based things, but really, you guys, I just do unconditional positive regard Rogerian therapy, where I'm so accepting of whoever and whatever walks in my door. And I really focus on what you bring to the table, who you are as a person, non-judgmental approach. Also, of course, I do play therapy. I use art in my work. I use a lot of use of books. It's really what you bring to the table will figure it out. I do a lot of process work, and just mostly containing the room. I've had kids and teens tell me, open up and share a great deal. And I honestly don't think it's because of my skill or CBT. I really think it's because I just contain the room and create the space, to be honest.
And Monique, I was thinking that in some respects, maybe not with acute illnesses or diagnoses, but in some respects, lay counselors, community counselors might have an advantage over in-office clinicians, in the sense that they have more facets and venues where they can join the children, and they can go to a ball game with them. They can play basketball with them, or they might participate in some activity. What are your thoughts?
Yes. Oh my goodness. If you can they say powerful communication typically happens sometimes in the car, because you're side by side and you're not looking directly, because that can be very intimidating. But if you can engage in an activity, some of my most powerful discussions was when I worked at the hospital and we were playing card games. Me and the child were coloring mandalas and then just talking. Card games, all kinds of activities in the hospital, shooting baskets in the gym. And then they're telling me they're talking about trauma, traumatic stuff while we're shooting baskets. So if you can add an activity with it, that is definitely preferred.
Right. In fact, children do prefer side-by-side communication through an activity rather than sitting in one place across from each other and okay, tell me your secrets.
Yes, that's intimidating. That's scary. In my office, I have, after COVID, we'll get back to it, but Candyland, checkers, I have a whiteboard we'll draw on. So yeah, that helps a lot.
So I want to go on to another question, and as happens sometimes, we rushed through the last several. Now, this has come up quite a few times. What and how to share with children regarding life events such as death of a loved one, divorce? When should parents talk to the children, and how?
Yeah, man. I think the key with life events like that is being honest in a way that's appropriate for that age range, right? They don't need to know maybe every detail, because keep in mind, little brains will soak it up and maybe overthink or not understand. But what they need to know are the facts. And again, it depends. I think it's in the chat right now, but it does definitely depend on the age of a child. What I tell a 2-year-old is going to be very different than what I tell a 16-year-old. And with divorce, that this is a common one, is making sure the child understands that they were not the cause of the divorce. They may still internalize that or believe that, but they have to know they were not the cause of the divorce, and that their needs will still be met. So my teens I work with, or my kids, will say, I'm worried that I caused it, and I'm worried that I won't have what I need, like food, clothing, shelter. Or I'm worried how my parent will be. I might have to take care of my parent. I've heard that as well. So letting them know that they were not the cause, their needs will be met, and hopefully mom or dad will take care of themselves and get the help they need. Regards to death, if there is a spiritual or religious component or background or cultural belief that helps make sense of it, I welcome that within the family home to make sense of a loss and how you can grieve. Done powerful interventions of writing letters to loved ones, sending them on balloons, creating memory books and scrapbooks with kids that have lost a loved one. I've been doing grief work with a 16-year-old for a year now. She lost her mom almost a year ago next month. And I got a journal for her, and it says, "Dear Mom, I miss you." And she's been writing things that she wants to share with her mom, but her mom's not physically present. So defining activities, but the key thing being honest and answering questions to the best of your ability as well.
And Monique, how about if the parent, if the child shares or insinuates that there has been some kind of sexual abuse?
Oh yeah, whew, that one is, again, I say inquiry. One thing I do, because I've done a lot of trauma work and stuff like that, is helping parents stay neutral, because your eyes, your response can shut a child down right away, right? If they feel you are getting reactive or getting distressed, they might shut down. If they start hinting at some form of trauma and they feel you can't handle it, kids and teens, they're so, some parents might not agree with me depending on the stage, but they're loving, they're sweet, they're caring, they care about their parents. And if they see that it's causing you distress, they'll say, never mind, never mind. But if you can stay very neutral and very calm and get as much information as you can, and then of course, reach out to authorities. You don't have to have a lot of details. You can leave the investigating to the investigators, but you can definitely reach out to the authorities or a therapist to help you navigate that as well.
Yeah, this is useful actually. I make this mistake where I react and then show, okay, oh my goodness, this is so gruesome, this thing. I think, yeah, I've heard this word, never mind, it's okay. You don't understand. So yeah, you're right, actually. I should have been more neutral, and then maybe they'll open up more, and then staying calm. Yeah, no, that's
Monique
true.
G, one question. You said we have to earn the trust of the child so that they can open up. Normally, they don't trust us immediately. It might take a couple of hours, couple of days, couple of weeks to earn the trust, right? Depending on the kids. So how do you, I mean, it is different for different child. Some parent may not, oh, I'm not seeing any effect in this counseling. I'm going to give up. They come to the conclusion, they jump from counselor to counselor as well. So how do you make the communication effective so that you can earn the trust? You are muted, by the way.
Yeah, it again goes back to that. They don't care what you know till they know you care, and explaining that therapy process to parents. And I also explain to parents that sometimes things may get worse before they get better. That's important to know, because I'm maybe talking about things that they've tucked away for a long time. So they're distressed, or maybe I'm doing behavior changes that they don't really like. So they get distressed. But if you stick with therapy, if you stick with it, the trajectory is a good prognosis, but things will get worse before they calm down and get better. If you jump from therapist to therapist, you're going to keep doing this, and there's not going to be anything going down. The symptoms, the concerns aren't going to subside. So it's important to know, I say good therapy, good counseling doesn't always feel good. Okay. I had a family terminate their therapist or fire their therapist because the therapist told them their daughter is suicidal. So the family was like, oh, she's not doing a good job because my child's suicidal. The reality is that therapist was doing an amazing job because she created this space safe enough to open up. The child said, I've been suicidal for years, but I trusted this counselor to finally tell her. And then my parents fired her. But so I had to explain to the parents that that therapist actually was doing an amazing job. And things, again, sometimes get worse before they get better.
Thank you.
You're welcome.
Yeah, maybe as a counselor, we should always tell this thing to the parents first, that, okay, try to stick to one therapist and then believe in the therapist if you really want to continue.
Yeah.
Yeah, it's a good one.
Yeah, try. Good therapy doesn't feel good.
Yeah, that's good, actually. Good to know that.
How important is the concept of God parenting? And Hindu families and communities here, we do not have a designated kind of God parent. And even if it works, till what age for the kids it works?
God parenting. I believe in I believe in the it takes a village mentality. So whether it's a godparent, aunties, uncles, I personally feel nowadays it takes a village. So if you have trusted adults in your child's life, they may be able to tell them and open up to them something that they can open up and talk to with their parent directly. So I am all about that village mentality for sure.
That's an interesting thing that has come up, which actually I didn't think about. Some families really forbid their children to share any family information with an outside adult. And I think in doing so, they might be hurting the emotional well-being of the child.
There's the family secrets, and shame, and it's everything that's in our home should stay in our home and things like that. And I understand that, of course. But you want to let your child know, hey, if something's happening to you or you're not feeling well mentally or someone's hurt you or harmed you, you can tell Auntie Puneet, Auntie this, and you can please do, because me as a parent, I trust that adult. So I want you to as well. I think it's so important, so important.
And sometimes it's easier to tell an auntie than to tell a parent. Yeah. So,
also, sometimes as we observe few things with friends, children, but how do we open up with the friends about that? That is also a kind of a dilemma, whether it will hurt the friendship or it will hurt the kid. Those kind of things are also.
I think Narayanji had asked that question at the start of our session. Aparna, I don't know if it's Aparna or it's just Aparna, it's just the name showing up next to. So Narayanji had asked that question and Monique had answered that, how to approach it gradually. And it's right at the beginning of the video that you might be able to look at. Another question, which is not so much about ill health of the children, but just a parenting question, Monique. How to balance nurturing and discipline?
I was thinking about this earlier when I was going through the questions. I believe children, teens need discipline, consequences. Children can't contain themselves. They may not like rules and consequences, but they need it. They need it if it comes from a place of love, if it comes not punitive, of course, never putting a child down or labeling them a negative, calling them a negative name or telling them they're not worth anything or they won't be anything. That's punitive. That's not recommended by any means. But having a consequence for your child is so important, starting at a very young age, It's so much easier when they're 2, 3, and 4 to put them in timeout than to get that phone when they're 16 or 17. It's a lot easier, but it has to be consistent and it has to be firm. So you can't punish them one day for doing this and then the next day it's okay, right? It has to be an established rule within your home. Expected behaviors, this is what I expect from you. This is what unexpected behaviors I don't want to see. Here are the consequences for the unexpected behaviors. Here are the rewards for the expected behaviors. So being very consistent and not reactive in your discipline too. We don't want to react out of emotions. If you're so emotionally distressed and heated and upset with your child, you probably need to step away before you intervene or before you have a conversation or before you reprimand them. Step away, take a moment, ground yourself, remind yourself this is part of development. They've made a mistake and they will make more. The whole front part of their brain is not developed, so they will make more mistakes. So take some moment for yourself, ground yourself, get into a more of a logical versus emotional side of your brain, and then have a conversation, a dialogue, a consequence. I do believe in time limited consequences. I do believe that you have reevaluation dates. So if you take the phone, you say, I take the phone, we will reevaluate on the 14th or on the 15th how you're doing. Not you're getting it back, because what about on the 13th if they slam the door in your face, right? So we will reevaluate at this date. I come from a positive parenting though approach, so rewarding, love, celebrating big. If your child does something like wash the dishes without you telling them, like act like they like won the Nobel Peace, right? Like jump up, shout, and thank you so much. Oh my gosh, I appreciate it. And they're like, whoa, I just did the dishes. But showing that appreciation, they're more likely to do that and then do more in the future. So I'm all about that.
So last question, and just short one. I bet you're tired of talking now for over an hour.
That's okay.
Monique, how do parents, whether it's Pooja ji, who might be concerned about her children's choice of how to get them to be in some kind of a focus in their life, or whether there is something we notice about children's behavior, how to sort of know that it's time to go for help outside of home, and how to approach that with children and with their spouse. Like, how does a mother tell the dad, or the dad tell the wife, or how do we approach that?
Yeah. Again, it comes back to development, where they're at. When Pooja ji mentioned her younger son and not knowing career-wise, my first question was like, well, how old is he? Because if he's younger, that's okay. That's normal. He may not know. I say expose your children to many things and see what may stick and what they like, or what they pick an interest in, or what feedback you get from teachers or coaches. But put them in as many activities as you can, and look into interests. I believe in informational interviews, having them talk to people in different careers and seeing what sticks. But I want to let you guys know, I changed my major in college 4 times before I figured it out. So even as a young adult, I wasn't quite sure. So that's part of it. Now, when is it time to look for help outside of the home? It's really when you've met those basics that we talked about earlier. You've had the conversation and things are just not improving. You want to look at a time frame. You don't want to wait too long. Some families come and they're like, oh, they've been feeling down for about a year now. That's too long. If you can, depending on the functioning or what you're seeing, I would say give it 30 days. If there's any risk concern, so they're harming themselves or not functioning, not eating, not showering, suicidal thoughts, right away. And to have the conversation with your child is just like if they had a medical concern, right? If they were fatigued or they had a bad rash or something like that, you would say, we're going to call your pediatrician and get this checked out. We have to start seeing mental health in that same light. It is illness of the brain. So we have to treat it as such. I'm concerned that something's going on with your mental health and your mental well-being. So we're going to reach out and get you some help. And I'm going to be with you every step of the way while we're working through this. And letting your spouse know that I have a duty to take care of my child and get my child what they need. And at this time, we need professional support and professional help. But the moment we start seeing mental health on the same platform as physical health, we will make a huge advancement and we will make progress and growth if we can start seeing it and treating it as such. And we will have children and families happier, healthier, and functioning once we start believing that.
Thank you, Monique. I mean, that's useful. I mean, I just want to ask one further question on, like you were saying that you should appreciate, like the dishwasher example that you gave, right? We should appreciate and celebrate it so that they do it next time. In the same line, I mean, what I've seen is like, this is just my first, if I do appreciate a lot and then it becomes an expectation. So next time also they will do it for appreciation only, or they will expect a reward in return. But what I want to teach them is they're part of the family. It's their duty to do it. So, I mean, how can I put this thought in their mind that, okay, they are also responsible for certain things in the house and they should not do it for reward all the time. Yes, first time you did, I appreciate that you are doing it, you are making it happen, but how can I make them not go towards the expectation thing, but rather go towards the direction where they take it as a duty, and then they feel that my mother is like, my mother needs help. We are part of the family. She's doing a lot for me, and then they do it on themselves. And is it bad? I mean, am I expecting too much, or can I do it? I mean, just that's the thing.
No, Pooja ji, you're actually talking about intrinsic motivation. That means it comes from within them. You want them to develop intrinsic motivation. I'm not talking about tangible physical rewards. I'm just talking about commending their efforts. Good job. Thank you. You did a great job. My hope, and typically developmentally, normally, is that you won't have to do that forever. They will have intrinsic motivation. They will know, Mom's going to be happy with this. Not every time will you have to jump up and celebrate, but you do initially, and then intrinsic motivation follows.
Okay.
Wonderful. Monique, thank you so much. I don't think that I could have done even a small percentage of this without your help here. And I would have been looking at all kind of textbooks and then just throwing it out there. You know, because I haven't really worked with children in my several, decades of career now. But thank you so much. Really, really appreciate it. And you are wonderful. And just wanted to thank you and let you go so that you can give your throat some rest.
Thank you guys so much. Thank you.
Thank you so much, Dr. Monique.
Thank you guys. I
Thank
appreciate
you. Thank you so much. Yeah, it was nice talking to you.
Thank you.
I think we all really enjoyed it and got lots of things that we could think about, right?
Yes, I'm glad.
Put us on the right track for interacting with other children, not necessarily your own, to be able to, identify and probably help as counselors and or just a normal human being,
So I just wanted to say before we end this to everybody that next Saturday morning when we do our follow-up session, we will continue the discussion. And if you want to bring in some individual issues at that time, I'll be happy to address that for you. That will be with me. And so you'll have to trust my judgment with that. But hopefully we'll be able to do it together. So that is actually your homework, to come back next Saturday morning at 8:30. That is indeed your homework for this session, because we'll have more of a dialogue and more of a discussion. And I think you're going to get more out of that than answering a paragraph somewhere. So, so look forward to seeing all of you 8:30 in the morning. I'm not a morning person, so I'm going to make it happen. So I think you can too. All right. So
Monique is very easy to be assistant to because she does all the heavy lifting. So, and I just have to show my face here. I'm enjoying it.
I had Monique's support this time, so that was great. I should do that for all my classes.
Thank you.
Okay. All right. Thank you so much. And I think it's break time, Usha?
Break time. Yeah. We'll have a 10-minute break. And then we'll be having Mangalaji and Kailashji with us next, right? I think you should put the schedule up probably so you all can see it, right? Let me share. Yeah, that's our schedule. So we have a 10-minute break. And then it's speaking at life in events. Now, this is a very, very interesting session. And I think, you guys are so interactive and attentive, so you'll enjoy it. And mentally prepare yourself, probably 2 people, if you can volunteer to do an extempore, attempt at speaking at life events. That'll be very, very interesting. So I'll let you go till 2:45, 9 minutes. Sorry, I took a minute of yours. Okay, so 10 minutes. Okay, thanks. Hi, Mangalaji. Hi, Suchi. I see my cousin there.
Hi, Usha.
Hello. Oh,
Good to see everyone. So
I know.
let me come back.
Yeah.
I almost forgot about the time change. So many reminders have come, but I was working on my computer and the computer time doesn't automatically change. We have to sync it, right? I kept looking at it and saying, okay, I got time. I've got time.
Well, I thought it automatically syncs. Your computer and your phone
Mine,
sync.
Windows 10, it didn't change for whatever reason. So
yeah, it's good when it's winter and you come to regular. That's fine. You get an extra hour and you feel thrilled. But daylight saving, spring forward, you've got to be careful.
Yeah.
Namaste,
Kailash-ji.
and
Namaste, Kailash-ji.
I'm here also to engage later on. In this
Yeah.
segment. Okay. Wonderful.
That was a very good session. I thoroughly enjoyed listening to Monique.
Very well done. Extremely well done.
Yeah.
The good, relaxed style and covered so many significant points. Very beautiful.
Like a wide range of really essential.
And Puneetji's the due diligence in question of preparing all that was very well done also both ways.
சோமு அந்த இது வேக்சின் எல்லாரும் அந்த அந்த லிங்கை யூஸ் பண்ணி நிறைய பேருக்கு இமீடியட்டா தே காட் இட் ஆன் சோமு. நிறைய பேர் தே ஆர் கெட்டிங் இட் ஆன் த லிங்கை யூஸ் பண்ணி. கேன் யூ bring your computer? You also try to register. சித்துக்கு நீங்க வா தரேன், நான் உனக்கு அனுப்பியிருக்கேன். I sent you. சித்துக்கு நீங்க ரெஜிஸ்டர் பண்ணீங்கன்னா நானும் சித்துவும் போய் போட்டு வந்துடலாம்.
Should I, Mangalaji, should I start the sharing?
Yeah, go ahead.
So should I do the program first, the agenda first?
Yes, please. Yeah, yeah.
And then we'll do. Is it good?
Mm-hmm.
Is Punichi coming back for the Q&A, or I think she's done, right?
She may come back because, you know, I did let her know that we are sharing the Q&A session for between the two of us. So I hope she does.
Okay.
Unless she wants to do everything on Saturday.
Saturday.
Yeah.
It sounded like she might want to do that. I don't know. So
Okay.
I'll just play it by ear.
Hmm.
Should I ping her and see if
You
she's...
check with her on the text.
Yeah, I'll do that. Yeah.
Ushaji, while we wait, I just want to kind of share that Saturday mornings have other commitments that I volunteer for the last 10 years. So I won't be able to attend. So, I just wanted to kind of, she said mandatory, so that kind of put me off because I don't plan to be available on Saturday morning. So just wanted to let you know.
Okay, I'll talk to her and we'll work something out for you.
I
Because
appreciate it.
that's the homework. Mandatory only in this sense.
Yeah.
That's your homework.
I got it.
So-
Yeah. So if you could help that, let me know. I could do homework for the class.
Yeah.
Yeah.
Thank
Yeah.
you.
Well, I'll talk to her about it. I'll let her know.
Thanks.
Who's that? Okay. I don't know how many people are on.
Yeah, it's hard to tell with every camera's turned off.
Yeah. I'm trying to, okay, I'm going to stop share.
Yeah. Let's go
Is
ahead and get
everybody back
started
on?
anyway.
I'm
Yeah.
going to assume that most people are back on.
Yeah.
You may request people to turn the cameras on, please.
Yeah. I think everybody's turning it on. So today, Kailash and Mangalaji will be, reviewing, presenting for you how you address, because you need to have a lot of sensitivity when you attend live events, right? So we'll be doing that, and then there'll be a Q&A at 4 o'clock, right? And then we'll address your homework and close for the day. Okay, so Mangalaji, shall I start sharing?
Yes, please.
Oh, shoot.
Okay, while Ushaji is going to share the screen, I'd like to say namaste, everyone. Very, very happy to see all of you. It's been a while. Glad to be here today, and I love to see all the smiling faces. Good to know everybody's doing well. Wonderful. So today's session, Kailash ji and I here to talk to you about effective speaking at memorial services and celebrations, meaning, the opportunities to educate somebody or, inform somebody about the life events that happen, whether it's a somber occasion or a celebration. And we're going to go through the different scenarios and how we do that. So you looking at the chart, I always like to include that in my presentations, only to make sure that we always keep that in mind. Like all of our life events happen along the 45-degree line. So this skill you are going to learn is no exception. It could be any one of those occasions along the 45-degree line where you may get an opportunity to speak to someone, to speak to a gathering, or even educate somebody, like in a classroom environment, in a school or a college, where you may be an invited speaker to talk about some of these things. Okay, all right. So let's go to the next slide, please. Okay, so before we get into who officiates a life event and all this stuff, I'd like to, bring a little bit of a context to why it is important for us here. I grew up in India, like a lot of you, and in India, the way things work, there is an occasion, whether it's a marriage or somebody's housewarming or whatever. We all gather. The priest comes in, the priest does what he does. We all participate in the puja, we sing our shlokas and mantras and all that stuff, and then we eat and then we go home. Sometimes we come to know the meaning of what is happening through anecdotes, through stories, and through just the fact that we live there. Everybody knows what a housewarming is, and nobody really explains to us. But what is important is, what does the priest do during a housewarming? What is the significance of the shlokas or the mantras that the priest is saying? We don't bother, right? I mean, most of us don't get to that until much later in our life, where we are intentionally trying to learn the meaning of all that. But in America, things are a little different. I may buy a house and I may invite a lot of my American colleagues to, for a formal housewarming. I invite a priest to come and do the Havan or Griha Shanti or whatever occasion it is to celebrate. And when we have a large gathering, what happens is, wouldn't it be nice if everybody knows what the priest is doing? So sometimes we will be in a situation where the priest may know how to explain everything to a gathering. As and when they go along, they explain the shlokas, they say, this is why we do it, this is the meaning of it. Sometimes the priest may not be capable of doing that. So that's an occasion where, it would be nice to have someone walk the guests through all these different events that are happening. Many of you probably noticed that in this country, memorial service is extremely different, very, very different from what we are used to, the way we were, doing things in India. As a woman, I've never attended a so-called memorial service, in the sense that I was not allowed to go to a burial place. And any kind of rituals that happened, most of the times, I wouldn't even watch it. I wasn't even allowed to watch it, type of thing. It was kind of like a very reserved thing, right? Let the priest worry about it. Let whoever is doing the shastras and the rituals, let them worry about it. The rest of you just walk away, or don't listen to it. Specifically things like Garuda Purana and all the stuff, we were not even supposed to hear it, because it is meant for certain occasions and things like that. But living in America, we know that funerals here are conducted in a very different way. This is where when somebody dies, whether they in the family or in a nursing home or in a hospital environment, the body has to go to a funeral home. People don't bring the body home. You are expected to take the body to a funeral home, and then whatever rituals that need to happen in the funeral home, that is where it is conducted. So the typical American way of doing things is, they go, they get the body embalmed, and then they have a viewing. A lot of times, that's an opportunity for friends and family to come and view the body. And then they have a memorial service where it is celebrated as a celebration of life, so to speak. Family members get to talk about the disease, the friends get to talk about the disease, they try to cherish all the memories the person that passed away left behind, and so on. So that occasion is kind of expected to bring a closure. It is like, okay, we know we are saying goodbye to this person, and then we are moving on, type of a thing. So living in America, we Hindus, in Indian folks, we have gotten used to that model of memorial service and so on and so forth. So HCI does provide the last rites service, and when we tell people, give them all the information about the last rites, one of the things we may be asked is, can somebody help me conduct a memorial service? Can you have someone come and speak and help the family deal with this, the whole occasion of this memorial service? So we have to look at it as an opportunity to help people in the community when these kinds of occasion happens. So like I said, the opportunity to serve, whether it's a somber occasion or a celebration. So again, looking at the context of how things are done in this country, who normally officiates a life event here? A chaplain, a rabbi, they're all they're trained both in the religious rituals as well as officially even conducting the ceremonies. Sometimes it's the one and the same person. A rabbi does a baptism, they conduct the ceremony, they also officiate the ceremony. So we as HCI volunteers, right, we will be providing we are between the religious person and the person who is actually conducting the rituals. We are in between, we are there to help, we are there to facilitate. Okay, so many times, even in this country, a volunteer or a planner or a facilitator can be paid to arrange that occasion, to come and speak at an occasion, to officiate an event, and so on and so forth. So they also play a role in that. And the reason why we do it is because, again, we want to offload some of the physical and logistical burden from the family, regardless of what occasion it is. If the family needs help and if we get requested, then such a help is given to them. Where, when, and how, that's somewhat obvious. The day of the event, if it's a celebratory occasion, or the day the memorial service or something is going to be held, which may be a different day than the actual day of the death of the deceased. And then the event location, again, it could be in somebody's house, it could be in a funeral home, it could be in a rented facility somewhere where they're celebrating the occasion. And in the COVID-19 environment, we have also learned to do many of these things online. If we are going to be talking to a group of people, educating them about a life event or a celebration, these days we don't have a choice. We do it online, we get on a call and so on and so forth. So until that environment changes, some of these services we provide will probably in the online environment. So let's go to the next slide. Ushaji, can you?
I think you changed already.
Okay, you're already there. Okay, sorry, I'm a little behind. Okay, so now that you know the context, you may ask yourself, is it for me? If somebody asks me to speak at an event, whether it's a funeral or a happy occasion like a housewarming or a bridal shower or a namakaranam or naming of the baby or whatever, can I do it? Okay, so you remember the service vision statement that you all filled out in the last class. It literally said, given all the different types of services that one can offer to the community, either within HCI in the capacity of a volunteer service volunteer or an Ananda Corps volunteer, or with another service organization after your certification where you may go, you may need to ask yourself this question: is it for me? Do I feel comfortable, speaking in a public environment? Okay, so how do you know what your skills are, and how do you prepare for the skills that you really want to develop? So if your vision of service is something that says, hey, that is something I would like to do, so these are the things that you may want to ask yourself and see. where am I in terms of my public speaking skills? Do I feel good about it? Do I feel confident about it? Do I have the knowledge and expertise to officiate? I may not have the knowledge of every samskara, but I may be very knowledgeable about some. I may know exactly what happens in a housewarming ceremony or at a Hindu wedding. That may be occasions I feel more comfortable with. That is okay. You don't have to know everything. But again, when you ask yourself a question, this is where you're going to gauge your level of comfort and your knowledge. And the third one, can I engage with the families and guests effectively? There are occasions where the family may ask you, in addition to speaking, can you also greet the guests? Can you also, welcome them and, do certain other things, to interact with the guests? And then the fourth bullet is, can I keep my emotions in check? And can I still be effective during somber occasions? For example, if you're speaking at a memorial service, would you be able to speak without breaking down? Because we are human after all. So the death of somebody or a sight or a sound or something may evoke certain memories in us, and we may kind of lose the control of our own emotions. So that's a question you have to ask yourself. If I am invited to such an occasion, will I be able to do justice? Will I be able to speak effectively so that the family or the people who have invited me, I can do justice to them? Okay. And will my own personal experiences affect my service? That's the other question you have to ask. Can I deal with the type of occasion that they're asking me to speak at? Okay, next slide, please.
Manlaji, can I ask
Yes.
a question here?
Yeah.
Actually, you said that your personal experience should not impact but won't it be the other way around? If your personal experiences are if you're too much emotional about that, and won't you make it more effective? I'm just trying to is it okay?
Yeah, it depends, Poojaji. It depends. The reason I'm saying that is because let's say, for example, a happy occasion is probably the easiest for everybody to do, right?
Right.
Whereas if you take a memorial service, for example, I may have had a recent death in my family or whatever, right? I may have had a death some time ago. I'm still not done grieving yet. You see what I'm saying? Because you really cannot put a boundary around how long somebody can grieve somebody else's death, right?
Yeah, that's true. Right.
Yeah. So that is why I'm saying, if you are still grieving, if you still haven't come out of your own grieving process or mourning process, don't accept an engagement if you think that you cannot handle.
Maybe
because
take a break and then do it later,
Correct.
basically.
Correct.
Sure.
Because
Yeah,
the
that
last
makes
thing you want to do is, a family invites you to speak because they are not able to do, right?
Correct.
They're asking you to help. And if you go there and you start crying and breaking down, that's not very good. Yeah.
Sure.
So that's the reason I, put that there.
Sure.
Okay. So something important I wanted to say is, typically here, rabbis and chaplains and any paid volunteers that are requested to officiate a function, they actually charge a fee. For many churches and temples, that is a way of generating an income. But as HCI volunteers, when you join Ananda Corps or a volunteer service, we expect to, we are to provide the service free of charge. Okay. So those of you that are moving forward and becoming chaplains or thinking about chaplaincy as a career, that's a different path for you. When you become an official Hindu chaplain, you can charge, you can do, provide the service for a fee that you feel is reasonable. But working for HCI in the capacity of a volunteer service or Ananda Corps volunteer, we will not be charging for that service. Okay. Yeah. All right. Next slide, please. Okay. No,
I think last one.
Mhm.
No, the one before that, Ushaji. Yeah, That's basically the basic components, right? Is that what, Mangalam, can you see that?
Yeah.
Okay.
Preparation, planning, and execution, right? Yeah. Okay, so now we know that we may get calls, we may be requested to officiate a life event, right? So now I know I have asked myself all those questions, I have prepared, I have, gained some additional knowledge. I feel very comfortable. I'm at that stage, let's say. And now it comes when rubber meets the road type of thing, right? So when you are asked to officiate an event, what are some of the basic steps that you need to keep in mind, and so that you can be very effective at what you do? All right. So we are going to take a look at each individual step and walk through each step in detail. But you got to keep in mind, you cannot skip any of these steps. Preparation is very critical, planning is very critical, and then execution is very critical. There are 3 simple steps, but you cannot skip any of them. Okay, and I will go through that and see why. Let's go to the next slide, please. Yeah. Okay, so you're asked to officiate a life event, and let's see how you prepare for it. First of all, you need to meet with the families. You can choose to meet with them in person, or you can choose to talk to them on the telephone, or use the technology, use a Zoom or whatever, especially in the COVID environment, to set yourself up a call. But you are going to meet with the family, because that is step number 1, to exactly understand what the expectations are. Okay. And so even the very first meeting where you are gathering information, you're going to introduce yourself, and then you can briefly explain your experience. Let's say, for example, I am volunteering with the HCI, and I am a volunteer service volunteer. Call had come in, and somebody had requested HCI to send a person to speak at this event, and I got the call. I was told, will you be able to help? And I've accepted that engagement. So what do I do now? Okay, when I call the family first, I'm going to introduce myself. I am Mangala Kumar. I am a volunteer with the HCI Volunteer Service. I understand you have a need for, whatever need that they expressed, when they called in. You're going to make sure, because that is the event that you want to be officiating. So whatever information was given to you, you are kind of paraphrasing, and you're making sure that that is the expectation of the family. And then say, I'm here to help you. How may I help you? Let's talk about the situation of the family. And then so basically you let them know that I would like to get to know you. I would like to get to know the purpose of this event, so that I can plan and prepare. And then you let the family talk, and they'll start telling you why what they expect from you, and so on and so forth. So that is the second bullet of understanding the requirements. Okay, so part of understanding the requirements is, am I going to be talking to a gathering? How many people? How many people do you expect? And what is the location? Is this going to be your house? Is this going to be an event taking place in a certain location, and so on and so forth, right? And because I think preparation is extremely important in terms of knowing, am I going to be talking to a crowd that has both children and adults, or is it going to be all adults? Are there going to be people other than Hindus, different religions? So that then you know how to prepare your speech, how to prepare how you're going to execute the function, and so on. So understanding the requirements, think of everything that you would like to know. And this is your opportunity when you meet with the family to ask all those questions, make detailed notes so that you can prepare for it. And the other important things is, sometimes the family may have more than one speaker at an occasion. Like, for example, in a memorial service, you may be one of the speakers. They may just want you to start it off and hand it over to somebody else. In other settings, it may be that you will be the master of ceremonies. They may want you to do more than just speaking. They may want you to also introduce the next speaker and the next speaker by name, and so on and so forth. So you need to, get with the family and understand all those requirements. And then the third bullet of understanding the situation. Every life event, there are things that are appropriate to say and do for that life event. And then there are a lot of things that are very inappropriate to say and do for that life event. For example, all happy occasions, right? We dress a certain way, we use certain words, and we behave a certain way. But then the not so happy occasions where a family is grieving, where a family is going through a difficult time, we obviously, want to be very, very sensitive to how this family is dealing with it, and how many, what is appropriate to say or not to say, during that occasion. So we are going to go into details of some of this also. But again, 3 important points of preparing for an event. Keep all the 3 things in mind. Okay, let's go to the next slide, please. Okay, so what are some of the steps involved in planning? Okay, so now you know that the family expects you to speak. Now, when you're planning, you are thinking through, if it is a happy occasion, what are some of the words that I want to include in my speech? Typically, in happy occasions, we say, we welcome everybody. We are so happy to see you. We are glad to see you. That's how we greet them. That's how we, want the feel and look of the occasion to be. Everybody is happy. And we use words like, pleasure, it's an auspicious occasion, so on and so forth. Whereas a somber occasion, like a memorial service, for example, you don't say, we are very happy to see you. You say, we are gathered here to honor. We are gathered here to cherish somebody's memory. We are gathered here to respect. And we are, we are gathered here to celebrate the memory of someone. So words are extremely important. So keep that in mind. It is when you plan, when you write your speech, when you rehearse, make sure that you're paying attention to all these words that are appropriate for the occasion. Okay, practice. The family asks you to deliver a speech. Again, from your requirements, you know that the family wants you to speak for maybe 10 minutes or less. They just want you to open up the memorial service, for example. So you don't want to go on and on and on and on. If the family has requested you to open it, finish everything in 10 minutes, time yourself. It is extremely important because family has other plans. The funeral home may have given them a specific deadline to say you start at this time and you want to end at this time. So you don't want to hog all the time. Keep that in mind. Your time is very critical and you need to plan. And then pay attention to the tone and the speed of delivery. As I said, when you time yourself, you will also know, how long it's going to take. A memorial speech, for example, you have to pause between sentences. You have to make sure the crowd is able to absorb everything you're saying. You don't want to come out like an exuberant speech, in other words, right? Because this is not an occasion where you're waving hands and doing a lot of actions and theatricals. This is more of a somber occasion. So when you practice, you're also practicing the speed of delivery and the tone you are going to use for your speech. And then the third one, attire and presentation. This, of course, is extremely important. The reason I want you to pay special attention to this is extremely important. I had an occasion one time where this person had committed to go to multiple events. So they had gone to they were going to go to somebody's mehendi ceremony in the afternoon, but they showed up at a funeral in the morning. And guess what? very, very inappropriate, extremely inappropriate. Whether you are a guest or you are a speaker at the occasion, it is very, very inappropriate. So don't commit to too many events in a day, right? Or if you are going to commit to it, make sure that you plan so that you dress appropriately for the occasion. And the second thing is a pleasant demeanor. It doesn't matter, what occasion you are at. Your job is to make it easier for the families to deal with the occasion, and your job is to also be very pleasant to the guests. Again, not being judgmental, not looking at anyone and making any assumptions, all the skills that you're learning as a counselor, all those things, this is the time where you put into practice. You're going to put yourself in the shoes of, I am here to provide a service to this family, and that is what I'm going to do. Okay. And then making eye contact and connecting with the audience is extremely important. You stand in front of the podium or you're standing in front of a crowd. If you're constantly looking at your notes and you're not even making an eye contact, that's not very good in any setting where you have a one-on-one type of a conversation. Especially important if you are connecting with the crowd, right? So make sure you look up occasionally. It's okay to refer to your notes, because sometimes you want to jot down notes about some important things that you want to incorporate in your speech, but that doesn't mean that you're always going to look down and never make eye contact. Eye contact is extremely important. That is how you connect with the audience, and the audience connects with you. Okay. All right, let's go to the next slide, please. Okay, so memorial service, speaking at memorial service is, like I said, it needs extra care, extra attention to detail, and extra level of planning. Because like I said, happy occasions are easy. You go there, you're in a good mood, the crowd is in a good mood, you're probably not going to encounter a lot of obstacles. But a memorial service is extremely important, and Kailash ji is going to also tell you a few things about this. He did a very fantastic presentation to us back in 2018, and I still remember a lot of things that Kailash ji shared with the class. So let's look at some of the things. Pick your words very carefully. As I mentioned, there are different phrases people use. Okay, we are gathered here to pay respect, or we are gathered here to say goodbye to whoever is the name of the deceased who departed this world on whichever day. Okay, and then we are gathered here for the celebration of life. That is also a terminology some people use. Again, when you meet with the family, you will know whether to use some of these words. How do they want to honor the person that has departed? So based on your preparation and the information collection from the family, you will be able to choose some of these words that open your speech. Okay, we are here to honor the life and memory of whoever that person is. Okay. And then the next bullet, we are going to pay utmost importance to the circumstance. Okay, I'll tell you why it is important. It may be an elderly person that has departed, and you're doing a memorial speech for that person. This person has lived a full life, right? And so as far as the family is concerned, the family needs a closure. And the family may allow you to share photos of this person, some anecdotes, some life stories, because obviously this person has lived a full life. Okay. Then we go to a younger person, right? And for the younger person, obviously, any young person that dies an untimely death, regardless of how the death happened, it is an extremely difficult occasion for the family, for the friends, and everybody to deal with. Okay, so again, we need to be extremely sensitive to that circumstance. And then the family may or may not want you to disclose how this young person died. Because again, everything depends on what the family wants. If the family says, no, I don't want you to say anything about how this person died, obviously they want to keep that, within the family, and we need to respect that. So when you go meet with them, if they say, I'm requesting you to do a memorial speech for this young person who died, you may ask that question, may I know under what circumstance this young person departed? And if the family says, no, I don't want to share that with you, just leave it. That means they're not comfortable, sharing that with you. On the other hand, they may say, this is what happened, but I don't want you to, put that in your speech. So again, think of this and say, I need to ask this family whether it is okay to mention certain things about this departed person. Okay. Another important thing is I know of young people, some people who have died in accidents, some people have died of cancer, type of situation. So regardless of what the situation is, like I said, it is extremely difficult for the people to share. If the person died of a certain disease, this person may not be so young. Like this person may be in their 20s or 30s or whatever, and they may have died of a certain disease. And the family, the reason the family wants to keep it a secret is because they don't want the word to get around and all kinds of stories flying. And if this 28-year-old person is alive, nobody has a right to know this person's medical history. Do we agree? Right? I don't want anyone to know my medical history. I don't want my son, the 30-year-old son's medical history for anybody to know. It is nobody's business. So, but if that person is dead, we need to have the same kind of consideration and sensitivity. If the family does not want to divulge it, if the family does not want to mention that this person died of cancer or whatever it is, do not include that in your speech. Okay. All right. The last bullet, it is extremely important to understand our purpose there. We are there to comfort, we are there to console, and we are there to connect with the family and the gathering so that they can attain some kind of a closure, with the departed person. So quotes from the Bhagavad Gita, from any scriptures, that is something you may want to use. There may be anecdotes the family will tell you, and permit you to use. And there may be some beautiful poems that fit the occasion that you may want to use. And of course, we all are familiar with lots and lots of teachings, whether from Bhagavad Gita or many of the gurus that we follow, many of the lectures we have listened to. It is literally a whole world of things out there for you to pick from. So again, respect the family's preferences. If they want to keep it completely a Hindu ceremony, your quotes and everything from Hindu scriptures and Puranas and the literature from the Hindu wisdom, that is fine. But if the family has no objections for you to pick different things from different parts of the world, and if you can translate them in a very nice way without the original thing losing the meaning, you are very welcome to use that. So again, this is something that you will find out when you meet with the family to say, are these things appropriate? Okay. And jokes, of course, are never appropriate for a memorial occasion unless the family says, this is the funny thing about this person and we want everybody to know, and we are here to honor, for example, a person who has lived a very full life, and this person was always laughing. It was their nature. They made everybody laugh. And if the family permits you to and gives you one or two anecdotes or incidents of where this person made somebody else laugh, by all means, go ahead and use that. Okay, let's go to the next slide. Okay, so before you go in there, like I said, you need to double check. First of all, you spoke with the family, you got all the requirements, and you have your detailed notes on what the family do's and don'ts are. So you check your speech you check your preparation against that requirements list you got from the family and say, yes, these are all the things they have asked for, and these are all the things I have covered. And these are all the things they told me not to do, and these are all the things I will not be doing. Okay. So, and anything they permit you to do, for example, they may tell you the departed is a mother, she was a grandmother, she was a sister to somebody. And, if you're allowed to quote all that, and if the family wants you to mention all that, mention that. And then in terms of what this person did, was this person a teacher? Was this person a doctor, firefighter, policeman, whatever it is, right? And if that is something that the family wants you to include in your memorial speech, by all means, because that is what makes the memorial speech much more comforting and consoling to people, because you're talking about somebody that is familiar to them in the role that they have seen. They have seen this person as a mother, they have seen this person as a sister, and they relate to them, in a certain way. So if that is comforting to them, by all means, include all that. And then the third thing is giving a sense of who this person really was, on top of the mother and sister and brother and whoever it was. They had a personality, they had their own interests, they had certain hobbies, they led their life in a certain way, right? So those are all important things, and you may gather that information from the family and say, would you like me to tell the people what a fantastic backyard garden they had? This person loved roses, and their backyard was, filled with roses. Or this other person, at the age of 60, they went back to the university and got a master's degree. Those are all, wonderful things that the family may want to include, and it is something that they would be proud of to share with the crowd. And for you, it will be appropriate to find out, what was this person like, other than your mother, and is there something that you would like to share with me that I can include in my speech? And you would include that if the family permits you. Okay. And then delivering the speech. Okay. So this is where it is extremely important that you prepare, you have your notes, and you practice once or twice in front of the mirror, so that you know what tone you're using to deliver your speech, the speed and timing yourself. And then, are you looking up from time to time and making contact with the audience? And then keep it short and sweet, meaning that it is about this person, it is about what the family wants, it's about how their requirements need to be taken. Don't start talking about your personal experiences. Okay. When my, so-and-so died, this is what happened, type of thing. This is not, your occasion. This is not the time for you to be, derailing the conversation and taking it in a direction that it is not supposed to go. So remember, you are there for the family at their specific request. So, deliver the speech with, that thing in mind. So the next one. Yeah, so I talked about the fact that you can use anecdotes, poems, teachings, all that, get a sense from the family, what type of, quotes they would like you to use, what kind of things that you would like to incorporate. And then the departed, they themselves may have been reciting a shloka every day. It may be a routine that they had followed. Every morning I sing my Suprabhatam. I don't drink a drop of coffee before I tell my Hanuman Chalisa. It may be any number of things that the departed, love to do. If that person had such a routine, go ahead and include pieces of that, portions of that in the memorial speech. And that is how, you're paying homage to the person that departed. And same thing, if this person wasn't a singer, wasn't into any Puranas or shlokas or anything like that, maybe there was a favorite book that they read all the time. Maybe it was a hobby, and there was one or two favorite things that they always talked about. if you learn from the family what it is, by all means, you can include passages from that book. If you can get it, you can ask the family if they have the book, and maybe take a look at it and take a few lines from that. There are any number of things for you to get very creative in meeting the needs of the family. The last bullet I want to talk about is, like I said, it is extremely important. Grief is very, very personal. When somebody says, my mother passed away or whatever, somebody passed away, anything they're saying, don't try to rush them into stop grieving. It is not up to us to determine how long they grieve. For some people, it may be a few days. For some people, it may be a few weeks. For some people, it may be a few months. And for some other people, it's a lifelong thing. I mean, they may not be sitting there crying every day, but suddenly they see something and that triggers a memory. Suddenly they watch something on television, or they read something in a book, or hear somebody say something, and that may trigger a memory, right? And then they may break out into tears. That happens to me all the time. I don't know about other people, but that has happened to me many times, and it just kind of comes out unexpectedly. So our job is not to tell people get over it, stop grieving, move on, all that things. If people need time to move on, they are going to move on. We are going to help them as counselors in that process. But we are not going to use that word, move on, forget it, stop doing it. We are not going to use those words. And those words are also not necessary to use in your memorial speech. So I do want to briefly go over some of the things that, from other traditions that they feel are appropriate. For example, Buddhism, they do have the concept of afterlife and reincarnation, just like we Hindus have. Our concept of afterlife is, we carry the karma with us, right? Whatever karma we accumulate, whatever punya we accumulate, that is what determines what we are going to be in our next life. That is a concept extremely well understood in Hindus who believe in the afterlife, who are spiritual, who are, like to think of it as whatever I'm doing today has a consequence, whether in this life or next life. So Buddhists also have the same concept. They do think of an afterlife, and they do think of a reincarnation. Okay, so Buddhist memorials, you will find them using those references, using those words, and so on. So for a Hindu memorial service, if it is appropriate, feel free to make references to some of those things. And then many other religions, right? They don't necessarily refer to afterlife or reincarnation, because that concept doesn't exist. They believe that when I go, I go. That's it. I am buried, or I am cremated, or whatever happens, happens, but there is no afterlife. I go to heaven. That is their concept. So for such services, you don't want to talk about reincarnation. You don't want to talk about afterlife, because this is not an occasion where we are imposing our views and our religion and our beliefs on somebody. We are just respecting whatever their affiliation is and whatever their sensitivities are. And in Christianity, it's a very common thing for them to say ashes to ashes and dust to dust. And the Christianity, again, they do not believe in a reincarnation. They do not believe in afterlife. So when you're done, you're done. You get buried and you become a part of nature and you go to heaven. Especially Baptists believe that if you are baptized, you are guaranteed to go to heaven. So that is their belief, and that is the sensitivity we may need to have. And ashes to ashes, dust to dust is an extremely common. It's used across all Christian denominations that I know of, without any reservations about it. And then there may be families, they're not particularly religious or spiritual. They don't necessarily want the ceremony to be skewed in one way or the other. Okay, they just want a simple speech. They just want to memorialize this person. They just want to the crowd to feel a level of comfort and consolation. So you may say, may this person go from this world in peace. Okay, that when you end your speech, that may be the last sentence you would include. May this person go from this world in peace. That is totally non-denominational, totally, not indicative of any religious belief or anything like that. But that would be very appropriate because, yes, this person is departing the world and we wish them peace, while departing this world. So that is a very safe statement. So if you are very doubtful, whether to use it or not, some of these sentences are very safe to use. I would encourage you to, Google some of these things and maybe pick, like I said, some very appropriate, things that you may find would be very useful to include in your speech. Kailash, before I go on to the next one, would you like to add something to this?
I think this covers all the nuances of it. I can just maybe put a little bit of perspective on this subject matter. I think Mangalaji mentioned that our tradition, is a kind of a more informal tradition. It's more festive and on celebrations, more somber on these losses that we do. It is limited to families, small people, women and children are kept out because they did not want to burden them with the burden of the sorrow. There was kind of, I think, obscure kind of a thinking in my mind, but that's what has been happening. And so we thought, now that we come back to our mainstreaming of our tradition, we have to pick the best practices. That's what we are, HCI, we want to do is convey what is best in our tradition. We also want to embrace things that are good in other traditions that make our mainstreaming more interesting, more easily understandable, and more respected by the others, our tradition, of course, but also by the others. And this public speaking and speaking at memorials and celebrations, I think is a very, very significant undertaking. And I encourage everybody in our team to become good at it. Practice is what it takes, and your determination to be a good public speaker. Public speaking is not easy, as we all know, but it is not difficult either if you have a cause and if you are determined. And so I think in this case, if you are invited by a family or if you are designated by HCI to represent us at a memorial service, that to me is a highly respected happening. I think only people who are highly respected for this purpose are going to be given. That is a very precious time. Memorial times are very precious time, and they are only given to people who are very special with regard to the deceased, with regard to the family, or with regard to the community. So number one is, if you really are not comfortable, if you cannot get impassioned about doing this, then you should not accept it. So that would be my first advice. Accept it with enthusiasm in a way that you are able to serve, you're able to do your bit, your part in this occasion, whether it is celebrations or it is a memorial that is happening. The second point is that your preparations need to be very thorough in writing and rehearse. It cannot be, you cannot wing it. You just don't want to go and just start talking and make absolutely not do a justice to this particular invitation. So I think formality, preparation, and all the detail that Mangalaji talked about, it has to resonate with the family. Hey, I'm going to do a couple of shlokas from the second chapter of Bhagavad Gita. Would that be okay? Can you tell me a couple of funny things about this, maybe an elderly person who passed away? Can I talk about some instances with the grandkids that were funny? Talk about the books he read or things that he did for the community. Things like you be in agreement with the family because you want to deliver this kind of address in second person, and not in third person. You know, oh, I heard so and so and so. here your grasp of this person has to be so good based on the work you have done and the due diligence you have done with the family and some of your own reading perhaps, is where you're able to say, like talking about a former friend or someone who was a good acquaintance, at that level of, because otherwise the audiences will not find it very interesting. They say, oh, yeah, this is really good. He knows about this person, this and that. So that's one more aspect of it. It's a second person kind of an address, not a third person address. The other thing you want to think about is there in the family situation, is somebody more, more in bereavement than other, like, are there a couple of grandkids who are very close to grandma and who are really, really missing her, okay? Now, if you can spot a couple of those personalities in your address, you could add that, that so-and-so, we know what you're going through. Your grandma was so close to you guys, I mean, put a little bit more, because you want to heal, you want to be able to make, to make this life celebration and the loss into something that people say, yeah, he brought my emotions up. He brought me into tears, even though that's not your intention. But by virtue of how you address that deceased personality and the family connections, you can make a lot of difference. And I think the final point I want to make is, when people think about that Memorial Day, they should be thinking about your address as one of the addresses that really conveyed the feeling so beautifully. So all I'm saying is, serious effort, the worthwhile doing it because you are really memorializing somebody's life and helping the family, serving the family in doing that. Mangalaji? So just
Thank you, Kailash.
Kailashji, will the 2020 batch have the honor of you sharing the memorial speech that you shared with the 2018 batch that Mangalaji mentioned?
Yeah, I think we can, Mangalaji, can we? Yeah, we have all the recording.
I think it's a recording. Yeah, there's a recording available.
Video recording. So Mangalaji also did, by the way, so I can tell you, she gave me the credit, but she was one of the ones who, in the class, she did one of the extempore speech also. So she and I, we were both there. So I think we'll share that segment with you. I'll get Gauravji to help me share that.
We need the link.
You shared the recording during our course time also, Kailashi.
That's right. We played it out.
Yeah, we did listen to it. It was one of very touching. Yeah.
Kailash ji, it's a good time to bring HCI exclusive Toastmasters to encourage public speaking.
Yes.
Yeah, it is a good time. I support that. I second it.
Yeah. By the way, two things we do. We want you to be super members of the community. I'm honestly telling you, we want you to be the best. And so we will take you through how to become a member of a board in the community organizations. Why should you become a board member? We want you to rise into those extended opportunities to grow yourself, but more important, also be able to contribute to the community. And public speaking is, I think, an outstanding ability, and everybody must work on it. It doesn't just come automatically. It's got some very interesting elements to it, and so I encourage that also. Yeah, if you want to do one day, one segment, we can squeeze it in with that. Is that what you're saying? You want to do a bit on it?
No, Kailashji, I was telling we should have our own HCI Toastmasters.
Oh, by the way, that'd be great.
Yeah, separate club, which meet every week, yeah, or it might be once in a month.
By the way, I love it. If you want to do it, I'll be very happy to engage with that. But Mangala is going to give you a chance today also to do some, right?
Yes.
Okay, good idea.
Okay.
Thank you.
All right, so let's go to the next slide. This is a little bit dark, but you're gonna see it better, I think. What I did was, this is like a cheat sheet from the Bhagavad Gita. Somebody had put together. At the bottom, you see the name of the Swamiji that put this together. This literally goes into every chapter of Bhagavad Gita. and then classifies into the different occasions. You can use those chapters and shlokas for. So this is coming in handy for any kind of a celebration. Yeah, like I said, whether it's a somber occasion or a happy occasion or any other occasion where you are informing and educating somebody, keep this handy. You can make a reference to that and look up those shlokas and incorporate them in your speech as and necessary, as and when necessary. So let's so specifically about the death and the bereavement, chapter 2 and the texts 13, 20, 22, 25 and 27, as I have highlighted on the side. Those are the more appropriate ones for the occasion of a memorial service, or when you're talking to even counseling them in a grievance situation. Those are the shlokas that will come in handy for you when you're trying to console somebody. Okay. All right, let's go to the next slide. Okay, Ushaji, I think we are coming to the, you want to talk about the lesson plan and learning objectives? Or you're on mute, Ushaji. Ushaji, you're muted.
Oh my God, this is being tricky.
Okay.
It's just jumping. So
no, I don't. I don't want you. I don't want to put you on the spot, but
it's okay.
Read through the bullets.
You'll only be putting me on the spot to the extent whether I paid attention when I was in class or not. Okay. So basically, what we got out of today, and this probably. You'll never get this kind of a very specific knowledge from anywhere else. This is something unique and something very sensitive. So today that's what we learned. How do I be sensitive to somebody's pain or joy, and how do I help coordinate? So basically that's what we were trying. We gathered from today, and definitely do get. We'll make sure you get the video of Kailashji's, memorial speech. It was really a very good example for us. And then I remember Jana did a very good one last year for us also.
Yeah, I think that should be added too.
I wish we could find that. That one was really good last year for us. So these are good examples where we know how to be, I remember when I was a kid, heartfelt versus hardy. When you're hearty means you're full of, it's a joyous occasion. When you say heartfelt, it's usually condolences is what follows. Those kind of, so I'm sure we all got a lot from this class, right? And then I think, Manglaji, is that enough?
Yeah, that's good enough. Let's go to the next one.
And then we'll move on to homework. And I think Puniji also should be in. And should we go over your homework first and then?
Actually, Puniji doesn't have any homework.
Yeah, she doesn't have any homework.
She just wanted everyone to participate in the Saturday session if possible, so that they can ask more questions and clarify whatever doubts they have and whatever questions they couldn't get to this morning. So, okay. So in terms
should
of
we do homework now or take a break for 10 minutes? It's 3:50. Take a break now, come back at 4. And then will that be enough time for everybody to do a little brainstorming or something, and 2 people volunteer?
Yeah. So what did we put on the agenda? Can you please pull that up and see?
So I think that's what we plan to do. Let me get the agenda. Stop sharing.
So basically, I think, what we wanted to do was take a little break, give you guys 15, 20 minutes to think through some scenarios and pick maybe 1 or 2 of you to actually present a little speech. I mean, it doesn't have to be too elaborate, just to incorporate some of the points we talked about. Imagine, either a happy occasion where you're, educating somebody, walking somebody through the steps, or a memorial service type of an occasion, everybody gets to write, spend 15, 20 minutes writing, and then we will ask one or two of you to actually present it to the class. Okay.
Mangalam, we've scheduled a 4 to 4:20 Q&A. So probably we could brainstorm ideas and then two people could speak.
I have a suggestion. I have a suggestion.
So we'll take a 10-minute break now.
Why don't you take the time right now?
Okay.
Go through the scenario that we are presenting, and then give people 20, 25 minutes, and then come back. And so they would have done what you want them to do. And then you can end with the last half an hour of highlighting couple of presentations. Or rather than two, you're saying two breaks, one break now and one later. I'm saying you don't have to do two breaks.
So what we are thinking is 8 more minutes, 4 o'clock, right? 4 to 4:20 is the Q&A.
Yes.
So they can take a very short, quick break now, get a cup of coffee and come back at 4 o'clock.
Okay.
And the 4 to 4:20, Punitji will join us for the Q&A, and we go through the Q&A. And then at 4:20, they get to go off and write their speeches.
Okay.
We can do that, or we can just take a break for from now to 4:15. Oh, I just want to make sure Punitji doesn't walk in.
No, I think you stay with your plan. That's good because you don't want.
Okay. All right. Very quick coffee break, 7 minutes, 4 o'clock. We'll see you at 4.
Okay.
Quick break. See you at 4. Yeah.
Wonderful. There's no need for this.
Okay. Let's hope everybody's back.
Okay, we're on time. So do you want to do the Q&A on the on what we just covered so people can get some ideas?
Yeah, I just texted Puneet ji. I'm not sure whether she is able to join us or. Let me get started. Maybe you can call her and see if she would like to join.
Yeah, I think she's on the call. Let me check.
Oh, she's? Puneet ji, are you?
Because she did tell me she's going to be on.
Okay, let's see. I'm not seeing her. It's okay. We can give her a couple minutes.
Yeah, because she said she's around. So
okay. So in my session, the thing that you just heard, the presentation. Are there any questions?
Manglaji,
Yes.
the question that I have is, it's having never done this before and never attended a memorial before, it's really hard to kind of put my mind around, like if I know somebody, I can even attempt to write about somebody, right?
Yes.
Knowing their past, present, and, you know,
Yes.
even as a friend or a little bit, but not knowing anyone, you know, and especially a family going through this experience and they requesting your help to do the memorial talk. Like, how do you do your research? Like, do they like, is it hours and hours? Like, how do you get to the past? Like, your slides were very helpful, were detailed, but I wonder in real life, like, how does it work out for a person you really don't know anything of, and for you to kind of go out there and make a connection?
Yeah, I understand. You know, it's always hard. But what we need to understand first and foremost is the family is looking for somebody to open this memorial service, right? Remember, this is something that we are learning, we are adopting, being in America. Because in India, this is unheard of, right? Nobody speaks and, you know, all this stuff. So a lot of families are getting used to this idea of, you know, doing a memorial service. And they're saying, you know, it's very hard for me to conduct this function. I'm just going to stand somewhere and, you know, greet all the people come in, because there are a lot of people that, you know, would like to see my mother or father or whatever, didn't get to say goodbye. And, you know, this being America, this being an opportunity for them to come and pay their last respects, this is what I would like to do. So they're looking for a friend or a family member or even a neutral party to just kind of open up the function, right? So that is number one. The family needs help. Okay, so when they call HCI, knowing that we are offering this last rites service and then followed by this speaking at a memorial service, they'll say, you know, they'll call and then say, can you assign a volunteer, you know, that can help with this? Okay, so you as a first-time volunteer, obviously, you know, we're not going to throw you there and say, okay, Nitiji, go do. This is your assignment. But at some point, you're going to do this. If this is a service that you would like to provide, right? If this is a service you think, hey, I think I'm going to be really good at this. I'm an empathetic person and I would like to help families and, you know, help them in their need. You know, I feel quite comfortable speaking. If you feel your calling, right? Or if you feel that this is a skill you need to learn, you can say, yes, I'm going to go meet with the family and then find out. So then it's a matter of, you know, what does the family need? If you just ask them, what are you looking for? You know, they'll tell you, I want somebody to, you know, come and start this thing with open up a speech, and I'm going to hold this from 10 o'clock to 12 o'clock. I want all the speeches and, you know, people to have an opportunity like this, and, you know, help me with the flow, right? So the logical flow would be for you to open the whole ceremony, right? Where you will be saying, we are all gathered here to honor the memory of this person and all this stuff. And you are going to fill your 5 or 10 or whatever minutes from the information you got from the family. Who is the person that is deceased? What did she mean to you in your family? And what did she mean to the community? And what are some of the things that I can say about her in this funeral to honor her memory appropriately? Right?
I think,
So, yeah.
I think that's very good. But coming back to your specific point, Nitiji, what you will find is there is a family representative. So you have to be very clear that you are dealing with one individual and no more. Because if you do, then you're going to confuse them and you and everybody else. So you ask for, okay, we are agreeing, I will be the HCI representative. I would like to know who the family representative is, and I need to spend 15 minutes with that person on the phone. You don't need more than 15 minutes, but you should have a checklist, like the cause of death, for example. Is that something to be talked about? Our grandkids, what do you want to say? What about hobbies? Try to get a picture of that person, like you want to become an acquaintance for that person. Not a friend, but maybe an acquaintance of the person. What information do you need? So that's really kind of not a prescriptive thing, but it's really more of your own thinking. What gets you comfortable? And if you forget 2 questions, you can always call them back. So it's not a long exercise, but your preparation from that point on becomes a longer exercise. That 15 minutes gives you enough tidbits. So that's the other part of it. Okay. Yeah. Does that make sense?
Yeah. So you can make yourself a little checklist and say, these are the questions I need to ask, so that I can prepare.
Right.
So, and I just wanted to add, even if it's happy occasions and you've got non-Hindus also attending the occasion, right, they may just call you to help, get them involved also by explaining to them what's happening. Yeah. Whether it's a wedding or a housewarming, what is the significance of certain rituals or rites or certain shlokas.
Exactly. Please make sure you add 2 or 3 Bhagavad Gita shlokas in there. That'll be very important. Then you have some work to do. Find the right ones and present them in the right spot in the speech. So that is where the real value comes in. Yeah.
So Nitiji, you put on your engineer's hat when you design a product.
That's right.
You need to know the specifications, right? How fast it should run, how efficient, how much it should cost, all this. That's the same thing, like writing a product specification. Exactly. Yeah. And also in the class, you will, a couple of people will get to speak. And then you will, when you listen to the recording from the previous classes, it will give you an idea, what to do. So from the homework exercise point, I've basically picked the 5 different types of examples for you. So
can I add a point on the previous one? Is it okay?
Yes,
to?
Right.
Okay.
Yes.
I think you raised a very good point regarding the sensitivity of, what we are trying to do and how we need to be sensitive. Also, when people are attending multiple events on the same day, right?
Yeah,
good and
exactly.
bad together. I think I thought to that there may be one more point we may want to consider, that when you go from an inauspicious event to an auspicious event, some families may not feel comfortable, they may feel hurt, right?
Yes, exactly.
So that aspect also needs to be, part of our do's and don'ts.
Yeah, the reverse of the 2 situations. Yeah.
Yes.
Very important.
Yeah, very important, extremely important. Yeah. Good point. So as I was mentioning, I've picked just 5 examples, right? So you try to look at those examples, say, you may know somebody in that situation, or you may be happy, doing a presentation for a happy occasion, right? So if you're familiar with how a havan is done or how housewarming is done, whatever, right? So you start with that, because not everybody feels comfortable talking about, every type of situation. For some people, they may fit a certain calling. They may, go in that direction. The other people may go in the other direction. I have actually, known middle schools and high schools. Many times they look at the, name Hindu community center or Hindu temple or whatever, and they call and they say, can somebody come and explain the significance of Rakhi, the Raksha Bandhan thing, or a holy ceremony and things like that, right? Or they may even ask you, when a child is born in a Hindu family, what are all the things that people do to celebrate the birth of a child? Okay, so school is an occasion where you will be speaking. Or like I said, it's an occasion where people have invited people from the North and South and Americans and whatever friends they have, where they just need somebody to walk them through and say, in this occasion, this is how it is done. This is the significance of putting the rangoli in front of the house. All happy occasions in Hindu homes have that, right? We decorate the door and we put the altar. We arrange the altar in a certain place. All those things can be explained, right? So pick your occasion But then, use it also like a grounds to prepare for other occasions. You can grow into, that area also. Okay.
Other point I think is that when we go, one of the reasons we are trying to institutionalize our thinking and our conduct in our communities is to have some kind of authenticity and consistency. So what happens is, if a mother is asked to come to a school from one county and asked about Hinduism, that mother's speech will have very little resemblance, or maybe some resemblance to other mother in county B or other father in county C. We do not have that, it's so, our tradition is so diverse and so spread over in so many scriptures. And what people choose to talk about, some people get stuck in sati. Sati is something that, century old. They keep dragging it right up front. Okay, so we have so that's why we need to be, it behooves us to be standardizing some high points about our tradition. The 15,000-year-old Vedic tradition, for example, our festivities. Why is Holi important? Diwali, we should have similar explanations. Right now, I can guarantee if we went around our own, this group, everybody will have a slightly different
view of how things are done. Yes.
So I think our effort has to be to bring things into a simpler, more authentic, more consistent format. And that's what we try to do on the website. We are, look at for example, the marriage, we have tried to bring it together. Punitji and the team, they did a good job of bringing together a kind of so every CHT can quickly review that and come out and tell the public what it's all about.
Yeah.
So I think it's very important to look for authentic knowledge when you're imparting that to the community in any way, because you are representing an institution, and we want to be seen as, they know what they're talking about.
Yeah.
Okay.
And another important thing is, a lot of rituals and practices, many of them are symbolic, right? The act of offering dan, whatever, in the hope that the departed soul travels further, on their way to heaven or whatever. We really don't know, right? But that's a belief. We practice that, and there is goodness in it. How can you donating to a person hurt anything, right? Yeah. Okay. So we are to be able to explain that and say, this is the meaning of that. This is what we believe in, and this is why, we do this. And then some other practices actually have a scientific basis. Like, for example, when we sit down, especially in the South, right? In the temples, you sit on the floor, and even in many houses, you sit on the floor and eat on a banana leaf, right? Banana leaf is eco-friendly. Way back when, our ancestors didn't have steel plates and, all this stuff. It's eco-friendly. And boy, even today, it's an eco-friendly practice. What can be wrong with that, right? And then they do the little, take a little bit of water, go around the food like that, and put some, rice on the side and all this stuff. That is meant to feed all the little critters, that live in the environment, right? So you're feeding, you're being eco-friendly, you're being considerate of other living beings in your environment, and so on and so forth. So many practices have a scientific basis, and many practices are symbolic. So I would like to explain all that, when I explain anything to somebody, because they are coming from no background at all, right? So rather than say, oh, this is what our ancestors did and this is what we're doing, I would try to find the scientific basis or the symbolic reason for it and then explain. We educate ourselves and we are educating them also in the process. Yeah. Okay. Any other questions?
Yeah. If you have questions for Punitji, she's also here. So either one of them. Any clarification on,
Punitji.
I'll ask a
Yes.
question for Punitji if nobody else is.
Yes,
So,
go ahead. I
Punitji,
hope I have the answers.
it's more a comment. So it was really a great session, and I felt there are so many gaps that we need to kind of fill in for the parents, where it's like helping raise children was so much easier in India just because of the extended family support, which you don't get here. And you're kind of, for lack of a better word, winging it on your own. One of the things when my children were in elementary school was Project Cornerstone, where they talk about filling the bucket, which is filling your emotional self before you can fill somebody else's emotional self. So I feel like as parents, a lot of time our buckets are not full. Parents get snappy. They don't hear through. I used to volunteer for an elementary school, and that's why I have a little bit more exposure into what children share when they're about their parents, and we kind of connected the dots with the counselors. But it was a really good example for everyone to sort of understand that it's really important for your bucket to be full, you to be emotionally complete before you can give yourself an ear to whether a child or a teenager, to hear them and try to even attempt to understand, where they are in their pain points.
True. Well said. Absolutely. I think, it's all about moving towards mindful living. When we are more mindful and intentional with the choices we make, then a lot of things fall in place. I think a lot of us have been so focused on career and achievement and success that our emotional health has been neglected. And we don't mind because we somehow push our emotions into the background. But we don't realize that when we don't deal with our own, then we can cause damage to our children whose well-being we do care about.
Monique, this is Narayanan. You raised a question to the speaker in the previous session about nurturing versus discipline. Right. Can you hear me?
Yes.
Oh, okay. So you raised a question about nurturing versus discipline. I don't know whether I'm right or wrong on this one. I somehow look at nurturing as a continuous improvement process, and discipline is kind of an incident-based process. So if the continuous improvement process over a period of time may eliminate the need for disciplining.
Well,
is it the right assumption?
Yes and no, because see, discipline does not mean punishment.
Yes.
Right? So for discipline, we create a structure, right? I think in our Vedic terms also, when we talk about discipline, self-discipline, we're talking about having a structure and a commitment to that structure. So that is really discipline. But what you're talking about is learning from consequences. To reinforce positive behavior is discipline. To celebrate when somebody does the dishes for you is, a child does the dishes for you, as Monique gave an example. That is also part of the discipline. It's positive discipline, positive parenting. So in that sense, when we consider positive parenting and we consider positive reinforcement and we consider structure as discipline, then that discipline needs to be a part of everyday life. And I want to add one more thing over here, which we talked about. She touched upon it, Monique touched upon it, but I really want to emphasize because for me that was a challenge. And as a parent, and I imagine it is for many other people here, especially as Neeti mentioned, that we are so spread thin, we are trying to work because we want to make more money so we can buy a house or whatever, as both parents. Then we want to be socially engaged because, if we don't put in the effort to having those social engagements, we won't build any relationships. It's not like our cousins are going to automatically invite us as it was in India. So we have to work on that. Then there is this pressure of sending our children to various activities for which we have to show for them. So I think one child requires at least 5 to 6 chauffeuring trips every week, then, you know, you don't have the house help. So you're cooking and cleaning and so on. So it's a lot for a parent to carry. So with all of that, consistency becomes an issue, because when we are tired, we let things go. And inconsistent parenting is far worse than permissive parenting. So Joe, just put in place those few things that you can be consistent with, rather than go for, 10, 15 things or 20 things, and then one day reinforce all of them, and then the other day you're tired, so you can't put anything in place. So keeping everything in mind, just pick up, so one person, one parent, one mother or father, as the case might be, maybe a high energy person and may be able to do all of these things and still be able to discipline. But another mother may struggle with some fatigue, may have thyroid issues or some other concerns of her own, and may not be able to provide that. So keeping all that in mind, come up with a disciplining plan that you can be consistent with. It doesn't have to be the very best, but it has to be consistent.
Sure. Thank you. Now, I did not mean discipline only with respect to punishment, disciplining through motivation too. But when you go through the nurturing process, it is a continuous effort in small increments, so that you inculcate, right, certain behavior pattern rather than a reward or a punishment. That's how I was thinking.
That's also right. Your point is well taken. That's also right.
Thank you.
So, hi, Namaste Mangalaji.
Namaste Sanjay.
Sanjay. So I had one question about when, say, if we are invited to speak to an occasion and say it a happy occasion or a not so happy occasion. Having said that, I think one thing I'm always want to caution myself that I must believe in what I'm preaching. So
Yes.
in other words, that you mentioned rightfully about the symbolic and then scientific, but even the symbolic, the counselor has to believe in what he is counseling. So I think we already have fundamental interest in the belief. Otherwise, I wouldn't be engaged with HCI too.
Yes. Yes.
So how do I further endorse my belief or try to get more resources? Like I saw a slide where you mentioned about the verses in Bhagavad Gita with chapter and so on and so forth. But is there anything out there which you want to standardize, or you want to leave it to the counselors to do their own homework, and so to speak, and then counsel others?
Okay. Yeah. So last year I had 2 scholars on my team. They worked in putting together information about some Hindu practices and so on and so forth. Right? It is like how do I set up a puja altar in my house, and can I use the swastika symbol? Things like that. Right? So they have put together some information. We are trying to finalize that so that we can, publish it and make it into a resource. And I believe Narayanji also offered to kind of look at those documents and add to, that. Chinmaya Mission has published a whole lot of books. They talk about doing arti, and making offerings to the gods and goddesses that we worship and so on and so forth. So they talk there is a lot of things about symbolic versus scientific. When we touch the arti, we go like this and we touch touch our thing. And why do women put the sindoor in the middle of their forehead? You can go on and on and on, right? So wherever there is scientific basis, we try to find out, and it can come from many resources that are already available. And I can, pull together a list for you on some of the things I look up personally from Chinmaya Mission and other sources that are, explained very well. But then there are also, some ritual practices, right? One time, this lady, American friend of mine, had gone to India, and she came back and she said, she found out that widows don't wear kumkum, but the younger, the married ladies wear it. If they wear red, that means they are married. If they wear black, that means it's a fashion. I don't know where she learned all that, but she had heard of all these things. And then while she was talking to people, she had also found out that when a woman becomes a widow, there is a ceremony where they break her bangles and they, all that stuff. And she couldn't understand. She was like, this person has already lost a husband and going through this horrendous process of dealing with it. Why would they do something cruel like that, right? There is definitely no scientific basis for it. There is probably not even anything written in the Puranas or scriptures or anything like that. It is a practice that somehow, came into being. Because maybe at one point in society, there was probably a need to reinforce something or make it official that this woman is not, accessible or something like that. We don't know, right? And we can only go back so many years and no. So how would you explain a situation like that? So we can only explain, to say, some practices are out there that are, very archaic. It mattered during that time, in that generation, but those things don't have any meaning anymore, and we leave it at that. And like Kailash, you mentioned sati. Who practices sati? And when was the last time, some sati practice happened in India, right? So whatever was relevant at some point, or whatever people thought was relevant, many, many years ago, decades ago, whatever, centuries ago, are no longer, have any relevance in modern society. And we don't need to practice those types of things. Yeah.
As you said, Chinmaya Mission has the whole list of all these Hindu rituals and routines that I had printed out, and it explains so many things. Why do we light the lamp, or why do we break the coconut? Why do we put the tilak and all those things? And it was really, really helpful. I had printed out, and I don't know whether it is from Chinmaya or something. And it explains so well. And even although we know it, although we believe in it, I keep reading it.
Yes. Yeah. And
please share the link. Please share the link with us. This is really useful. We all can go through it. Thank you so much for sharing.
Yeah, maybe we can add it to our knowledge base somewhere, because these are good pieces of information.
I have a suggestion for that. I think Dr. Srinivasan, who spoke last week, remember, who talked about samskaras. He has written the book called the Hinduism for the Dummies.
Yeah. Hinduism for Dummies. Yeah, that's what you mentioned.
Get into massive treatises, and you don't want to become scholars of all these explanations. That's not a good use of our time. I think have a handy that and let people go back and read, because then they're all reading the same Dummies book, and he's a very knowledgeable man. He would not have put in incorrect things in there.
Yeah.
So please, let's use the Dummies as a reference point.
Right.
And otherwise, you're going to get lost with so many other books from different missions and different swamis. It'll be complex. That's my feeling. Yeah. But coming back to Sanjayji's question, last year we also had a collection of Bhagavad Gita specific shlokas and their meanings in this session, memorial session. That may be available too. It specifically deals with memorial related shlokas. I think it was Lataji who put it together. So there is some of that information. We're trying to create what we call these knowledge assets.
Knowledge bases, yeah. Knowledge
assets for different things. And and again, you can jump in and say, let me put that knowledge asset together. Anybody can volunteer, and we can put it up as a standard document as long as it is authentic and done well. So.
Right. And another resource I would suggest is Gayatri Parivar. They have a website, a lot of books. They're published in many, many languages, actually.
Good. Yeah.
And they explain each and every havan, every samskara and all that stuff. Very good information. So you can look that up.
And they're our partner.
Yeah. So we are at 4:30 right now. I'm wondering if we should give everybody some time to prepare a little speech and one or two people present. Ushaji?
Does it have to be 10 minutes, Mangalaji? 10-minute speech?
Well, if
Yeah.
you're ready now,
10
you can
minutes is a
go.
long time.
If somebody, yeah, if somebody wants to just
Before you
talk
want to
about
try
it, go ahead.
By the
Yeah,
way, 10 minutes would be a long speech. I think 5 probably is a more
right.
more like what they would ask you to do. 10
Yeah.
minutes would be a
3
son
to
or
5
a daughter
minutes.
or somebody doing it for the
Yeah.
deceased. So, yeah, 5 probably is a better measure.
Yeah. If somebody wants to talk about anything that they are they feel comfortable about talking, let's see some hands. Let's see if anybody wants to do it, and then we can let the class go.
I see
Before
ready.
Yeah, no, before we move on to other subject, I had a question about the last session that maintaining uniformity in our statements is very important. So because different rituals may have different scientific basis or might be symbolic in nature, but everybody's understanding might be not exactly the same. So we don't want to confuse the society or community.
Yeah.
So that how do we maintain that uniformity by going to the particular knowledge base, or we can go around and explore ourselves and find out different resources to understand certain gravity of the certain rituals and
Yeah.
explain it.
Yeah, I would, I always look at different things, and whatever makes the most logical sense to me is what I go with. Because there may be more than one explanation, but what makes most logical sense, that's what I would, go by.
Rajuji, I have a different, slightly different suggestion for you. We are a very early organization. We're making an attempt at bringing some authentic, common information. We're not going into South, North, West, White, Shaivites. We are not into that. We're trying to create a simple view of Hindu tradition, the way we have in looking at the diaspora. And it's going to take us time to get there. In the meantime, if it's a very serious issue, you could say to the person, let me think about this. I think it's a good question. Let me do some digging for you, and I'll get back. Don't feel compelled to jump in and give an answer right away or guess if you're not comfortable. That'd be one advice, as we all learn. And the Sangha, you should have somebody in the Sangha that you know. You can make a call and say, hey, by the way, what do I tell this person who's asking me this and this question? What is a good answer for it? And what is your basis for it? I think we should refine our positioning, because we want to get mainstreamed. We want to have a consistent view of our own traditions and so on. It's going to take some more thinking and working. But don't feel compelled to give the best explanation that comes to your mind right away, because there's no Pope. They're checking us out. We don't have a papacy or somebody saying we cannot say this, you cannot do this, Hindus don't do this. There's no such thing. Ours is a way of life. We don't go with beliefs, or we don't go with we're a questioning tradition. I can question you, you can question me, and we're good with that. Okay, so all right.
Thank you, Kailash.
Yeah, so is anyone ready to speak now, or shall we? I don't see anyone raising hands.
Also simplify, Mangalaji, using the STEM approach, we can say, what are the specs, what are the highlights of a spec in this particular case? What would be the top critical 3 or 4 elements that you would be looking into to create a speech for this particular occasion? That's another way, rather than a whole speech. What are the 4 things in a naming ceremony that you would want to have in your hand before you write a speech? Or a old person, deceased person's memorial, what would be the 5 or 6 things? Maybe you can sort of look at it that way.
Yeah, so they're all part of the homework. So people can take a quick look and see if somebody can think of it. Ushaji, can you put up the homework slide, please? Yeah.
Sure.
I've laid out 5 different scenarios people can pick from. So take a look at it and think for a couple of minutes, and maybe you can volunteer yourself to say, no, number one, I can think of 3 things. Number 2, I can think of 4 things, like that.
So we have, a memorial speech for an elderly man that departed after a lengthy illness, or a memorial speech for an elderly lady that departed naturally after leading a full life, or a namkaran samskara for a baby where guests of different faiths are invited, a birthday celebration with a havan where guests of different faiths are invited, or a presentation to kids and teens 8 to 15 years of age about Deepavali or any other Hindu festival.
Hindu festival, yeah.
Okay, maybe just a comment or just a topic of discussion.
Go
So for the number 1, right, a memorial speech for an elderly man that departed after a lengthy illness. So if we just want to describe the elements, then I would just say that we'll ask the people if they are really if they really mention that it was a lengthy illness, and if they're comfortable talking about it, and how did that elderly man contribute to the family? I mean, was he very loving, and the grandkids were close to them? So I think these are the elements perspective. But I myself, I mean, if somebody so in Hindu religion, we really say that, okay, if your karmas are good, you have a very natural and peaceful death. But getting a long life is also, I think, is a blessing, and that comes only if you're I mean, these are all the beliefs I'm just talking about here. I myself want to be clear in my mind before I just say something. So I'm just putting things here, so just to get answers on that. If you get in age, I mean 90s, or I mean, if you're above 80, I mean, that's a blessing in its own. And then, but you have a lengthy illness that says it's a bad karma. I mean, it's kind of contradictory. And I really want to understand, what does that, maybe there are knowledgeable people here who are who have read a lot about karmas and Hindu religion, or from any religion. How does this how can somebody explain this part, where you have age and then you have lengthy illness? And what I have heard, and at the minimum, is some people really want to, for example, who was the in Mahabharata, right? He was put on the thorns. I don't remember the name of the he was a very sacred person. He was very
Bhishma.
Bhishma, right? When he died, he was put on he was, it was not a natural death, but he wanted to go through that, so that whatever things he did by mistake or unknowingly, also you do a lot of things that you don't want to do, but you eventually have to pay for those things. So he chose to pay for those things in that life, and that's why he chose that kind of life. And he eventually, he just get rid of all the bad karmas and went to heaven. So is this something also true for person who actually they are actually trying to pay for their bad deeds, what were done unknowingly, but getting and having a long life is something they want to use it, rather than just going for natural death and then pay for those things and further births and then take care of it? I don't know. I'm just putting it here. Yeah, just want to
outside the scope of this subject.
Yeah.
You are going deep into the mythology.
See, the thing is, we don't get to decide where we are born, how we are born, how long we are going to live, right? When we are put on this earth, all those things are decided for us in a way, right? So when we go into a memorial service for that person, we really don't want to go into all that. What you need to find out from the family is, what would you like people to know in terms of how this person lived their life, right? And for the family, it may be a relief that this person is no longer suffering, right? And so we don't want to get into all this thing of, oh, he died with a lengthy illness, although he was blessed with a long life. It was not a good life, right? I mean, we don't want to draw that conclusion. We don't know. So
I think the fundamental point you would say, you would want to get a sense of the following. Okay, for this person who lived a long life, but with illness, for example, do they want to mention the service givers who were so gracious? And he was so lucky to have the services of these people
family
around him. What a love of the family. What an amazing situation. Like, do they want to mention that the family has really said it's a blessing in disguise in some ways? Would they want to be comfortable with that scenario? You don't want to go into the karma yoga and all that accounting. That is not the role here. The role is to provide solace, provide celebration, thank the people, and what have you.
Yeah.
Okay. So look for the fundamental things. What is significant in this person's life, and whatever happened. Okay.
Yeah, I agree. From my perspective, and I'm like going there, I'll be very shallow and just explaining the good things and making comfortable. But if somebody asks you this question, right, this way we are saying that somebody, so yeah, maybe like I was just
No, I don't have, I don't
okay.
know answer for that one, and that's why I said maybe we should, in one of the Hindu discussion we have. By the way, wonderful. We're going to have Anayaji. He's an amazing scholar, Bhagavad Gita. He will be coming in one of the lectures in the next few weeks, and he's going to definitely talk about the subject of death and the karmic interpretation of a Hindu life and reincarnation. He will be very much into that subject matter. So keep these questions for him. Anayaji Deshpande. He's a scholar of this Vedanta and a teacher. Yeah.
I just want to mention something that people hide behind the explanation of karma for a lot of things. I've heard people say, "Oh, I was expecting a boy. I had a girl. What karma had I done?" I mean, just giving birth to a girl child, they think it's a karma. It's a bad karma. This is like that to me is like unbelievable. I think people say all those things because they want to hide behind. Correct. And
But I think Rukminiji has a question, Mangalaji.
I just wanted to specifically about the question, when somebody died after a long life, under a lengthy illness, you could say that this person, despite the long illness, was very gracious. How very nicely handled life despite all that. Those are points that you could ask or just mention, because all of us are going to go through some problems in life sooner or later, and this would be a lesson that we could take, we could share. Despite the long illness, he was still kind to somebody. He was so thankful. How he handled the illness, that'll be a point. That'll be something that's pleasant to discuss.
Yeah. So one way to say that is, he was very ill. He was too ill. When you talk to the family, they'll tell you. But he never forgot about this, or he never forgot his daily whatever was his favorite thing to do. He never showed it in his face. He never put us through extra hoops to make him comfortable and all that. So there may be a lot of good things that will come out. So the illness itself doesn't have to be discussed, but what that person did, how he dealt with it, and all that may be a more important thing to mention.
How he fought the disease, that's all bunch of things.
So Mangalaji, I just wrote up something, but it's nothing anything, but this will be like just for a happy occasion. I would say thank you all for joining on this happy occasion of cradle ceremony for baby Ishan. Cradle ceremony is usually done or performed a little differently, in various places from where they are from, but it is usually to introduce the baby to the family and friends. Usually the ceremony is performed on the 21st day. They also do Namkaran, which is the naming ceremony of the baby, and also to let everybody know that whatever is in the name of the baby, and show the baby to everybody, so the family and friends can meet the new baby. In US, usually the friends just kind of come in to see the baby, but usually in the olden days they used to have this so the baby is healthy and the mom is recovered from the delivery and all, they used to take the 21 days time, which is 3 weeks, and they perform the ceremony. It's a happy occasion to introduce the baby to family and friends. So, and thank you all for coming and joining and bless baby Ishan on this happy occasion.
Very good. Yeah.
Homework is done.
So that is, one of the things when people say, why wait 21 days? There is a scientific explanation, right? It is meant for the mother and child to recover and be ready to mingle with the crowd. Yeah.
Yes.
Because the baby has zero immunity when it comes into the world and stuff. Yeah. Very good, good explanation.
Mother is tired.
Yes.
Yes.
Mother is very tired. Exactly. And mother
No,
may
I
have
think-
gone through surgery, right? Cesarean and other things. So they need extra time to recover. Yeah, exactly. Yeah.
And other thing is, in India, the environment conditions, like in the US, everything is clean, the environment is clean and everything. So there they really want to keep you isolated in the sense that, okay, the dust and everything, we want to keep them away from. So smoke and dust. So I think
exactly.
it makes sense in India, more there. Yeah.
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 Anyone else? Okay, so I think you all have an idea, a good idea. So please look at the scenarios in your homework. And then if you have any questions, we are going to be here Saturday for the discussion. When Ushaji, it's going to be at 8:30, right? Not at 8 o'clock, is that right? Yeah. I think Punitji prefers 8:30 and so do I, or even later, Saturday.
Manglaji, I thought Narayanji had a question.
Narayanji, you have a question?
Oh, no, I just thought of, sharing. I just picked up the happy occasion like Diwali. How do you explain it to 8 to 15-year-old? And that's the kind of, I just read the question directly, but I may not pick exactly the same thing. But I think for 8 to 10 years, the fun and frolic part of Diwali has to be explained. And when you go 10 and 15, we can start talking about the differences in how we celebrate Diwali in different parts of the country. In northern India, it is all, Ram based. In southern part of India, it is Krishna based. And actually there are some Buddha based. And so we can give some highlights from different parts of the country and say the festival may be called by the same name, but there may be nuanced differences in celebration. So, and lead them into the Google search for the 15-year-old so that they can go and explore further as to how they are celebrated. Starting with their own personal family. Because
good idea.
If I want to understand how authentically Diwali was celebrated 300 years ago in Gujarat, I have to go to Eastern Africa to find out some old Gujarati families celebrating
friends who
Diwali.
did. Yeah, exactly. Exactly.
Isn't
Yeah.
the Lakshmi Puja and
yes,
that at the heart of the of the instrument, yantrams are different, but the purpose is basically the prosperity, right? That's what
correct.
I think that's
So something just occurred to me. In India during Sankranti time, right? In the south, I think Karnataka, Andhra Pradesh, and Tamil Nadu probably all celebrate this. They make a mixture of sesame seeds and good and all this stuff, and they kind of go to friends' houses and they give it, exchange, and all this stuff. So last year, because of the Corona scare, right? So they couldn't just freely go visit everybody. So they had like a exchange of those things, and a mask, a package of masks was given as part of the gift type of thing. So the thing is, it's a very sensible way to celebrate, right? You are happy, you are celebrating, you are not giving up tradition, but at the same time, you are adopting for a good reason. So, that's a good thing to mention
Things
too.
evolve with time and context.
Yes. Yeah.
By the way, Sankranti sesame laddus are also popular in the north.
Yeah.
They are all the way to the Himalayas.
Yeah.
In cold, it provides a lot of comfort. Actually, it's good for your health when you eat sesame seeds. It gives you energy and
Correct.
And calcium.
Yeah. So it's again, many of these festivals use certain foods, right? because I think it's a season. That's when it is available in plenty and your body needs the nutrition. So they incorporate that in food. They eat during that festival season. So there's a lot of meanings behind why people did all that. So
And there were no gardens earlier in olden age. They used to eat whatever is available, and then there was no way to store them. I mean, unless it's. But nowadays we have like everything available throughout the year, so things are fading away in that sense. But
Regional, it is all regional way of doing it, but it means the same thing.
Right.
In Maharashtra, they give till, and they say till good gab god bhola. They say that even in the college and schools, they bring a packet of till and then give it to everybody.
Yeah, I mean, now you buy prasad in shops, right? You don't make it.
Well, that's a modern day convenience, for busy people. Yeah.
On your way to the temple, go into India, cash and carry, buy it, and then go to the temple and hand it over to the pujari.
I know. A few years ago, I was telling my cousin, I called my cousin up in Chennai and I told him, oh, I'm getting ready for Diwali. I'm making all these, for Sri Jayanti, we make fresh, right? It has to be kosher. Get up in the morning, clean the kitchen and start cooking everything for that. So, and you have a list of 10 or 15 items that you're making and all that. And he said, what's all that, Usha? We just go to Grand Sweets and tell them, this is the community we belong to, and this is the date we need it, and they'll make it, and they know what.
Yeah, even for Naivedyam, they bring it.
And we trust them to be kosher and everything.
Yes. Okay. So before we end the session with the prayer, I do want to, mention one thing. Neeti ji in our team wrote a grant application to the Livermore Temple, and HCI received a grant. I was at the grant ceremony yesterday. Thank you, Neeti ji. Good job. So let's give her a big hand.
Well done.
Yeah, well done. Thank you. Okay, I think we can wrap up the session and meet on Saturday.
Yeah, Saturday, 8:30 a.m., right? Same
Yes.
link.
8:30 a.m.
Let's do some deep breathing, okay? Relax your face, shoulders, your belly. Take a couple of deep breaths. Breathe in, watch your belly expand. Let go. Breathe in again, deeply. Let go. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid
dukkha bhavet. Om
Shanti,
Shanti, Shanti.
Let me stop sharing. Thank you for a wonderful session, Punitji, Mangalaji, Kailashji. Thank you. I hope everybody enjoyed it as much as I did. Thanks.
Thank
you, everyone.
Thank you.
Yeah.
Namaste. Good night, everybody.